Eh. Um, we talked about streaming at 7, but you know, life is chaos, so here we are. Just kind of hanging out. I could take this moment to try and see if there's an extension for OBS on Mac to include the chat on screen because I don't know if there is. Also, I'm talking to my good friend Chloe about how life sucks because we can't get vaccinated for a long time. Also, today is a no makeup pajama day. I did put on a shirt before this stream, but it's a very lazy day, so you get to see my face without makeup. OBS, chat window, Mac. Let's see. Oh, can you even hear me also? Why don't we get some jams in here while we're chilling? Boop, boop, beep, boop, boop. Puppy. We're just gonna jump into stream beats. Simple, straightforward. Give me a shuffle. I forgot I updated my operating system, so you probably can't hear that. Look at my massive forehead. I should do body painting. Just paint on my forehead. Sorry, I'm staring at my own face because I'm not wearing makeup. What's I gonna do? I'm gonna jump on here in the settings, and I've got to change the sound. Okay, now you can hear it, but I cannot. There we go, multi-output device. Hello? Cool, welcome to my jam. How are you today? How is your life going? Weird red spot right here. The heck? I mean, I could bust out my iPad, or I could play Minecraft. Chloe was gonna get on Minecraft. Back to Twitch. That was loud. Also this. Go to your channel, please. Go to your channel, please. That was a lot. That was very loud. That was a lot. That was very loud. Oh, and now I'm echoing. Echo is echoing. Okay. Now that I've got that nonsense sorted out, it should be fine. Yes? Can you see things and they're good? Hey, Betsy. Hello. Dan's gone to jump in the shower. Hello, James. And Quinn and the Drac, like a dragon. Hello, Seasprin. Hey. A debatable human and Regan Grades. Regan Grades. Am I saying that correctly? Hello, Jen Ricky. Hello. Hello, dear friends. How are you guys? What is your life? What's going on? I'm kind of just chilling here while I wait for other people to finish doing what they're doing. I mean, I could jump on Minecraft. Also, this window is not frustrating. Okay, anyway. How are you? How are you, lovely humans? Okay, here's a weird thing. Do any of you stream, perchance? I need to remember to feed my dog. I just saw his dish, and he's laying next to it. Look at my dog. I gotta show you this. This is my dog laying next to his food dish because he wants food. Do you see him sitting in the dark? He's a cutie. Anyway, I was gonna say, I'm trying to get chat on screen so it'll be like there, like in this nice little spot. But I run everything on a Mac, on like a iMac, because I'm a loser designer, okay? I like both Mac and PC, but I sold my PC to a friend or ex-friend, whatever. I don't have my streaming PC anymore, so I'm streaming on my Funtime iMac. His name is Raw. But yeah, and the OBS version for Mac unfortunately does not allow a chat window for some reason, so I've got to get like a plugin or something. Yes, Ra is in the Egyptian god. So I name all. So my laptop is named. Is this tea? Oh, my coffee. Thank you. So my laptop is named Phoenix, and my iPad is named Hippogriff, and my iMac is named Ra, and my old iPhone was named Claire, which has nothing to do with mythical birds. But I like to name all of my fancy things after mythical birds because it's fun that way. Is it lagging? Oops, sorry. C-Sprint says I'm role-playing with a girl? Or, no, sorry. I saw the G and never mind. C-Sprint says I'm role-playing with a friend. What are you doing? Right now I'm just chilling. Dan's doing things. Where's the headphone on this? I might have to switch to my other headphones.
Yeah, I might have to switch to the...
You could... I think they're upstairs. I think that these headphones are shitty enough that they'll pick us both up, but we'll see. We'll figure it out. It's whatever. Hello, Gabe the Magi? Maggie? I can't read usernames for crap. Maybe that should be one of my, like, donation things, is like, give me points and I'll pronounce your username incorrectly. Oh, this is not good. My dog, you're gonna knock over my computer. Can you step back over the cord, please? Thank you. That was not good. Oh, Jinwiki is Annie. Okay, cool. Hello, it's nice to see you. What are you up to? Dan's over there. Doing something. Are you just finishing up work? Nice. This friend says my vlogging camera is named Adrian and my Instax camera is named Marionette? Am I saying that correctly? My camera is named Cass or Dean. I can't remember which one. But I know it's named after one of the supernatural characters. Didactic Lizard. Oh, I like your username. Says, how are you? Right now, I'm doing all right. You know, I've had such a lazy day. From Miraculous Ladybug. I like it. That's a show that I always meant to watch and never got into. But yes, I'm spacing out. I had a very lazy day. My dog is gonna be so upset because he wants food. Where did he go? Oh, he left. Do you want to feed my dog?
Sure.
So there's a cup in the pantry. You're gonna have to be on this side, I think, because that's where the headphones is.
My chair won't fit.
I believe.
Or we might need to switch.
Oh yeah.
Should we? There.
Okay, here. Let's try switching chairs. You can have the crappy chair.
Yeah. Does this will fit like here?
Yes. Yeah. This is a giant chair. Why do you have this?
I don't know. Okay, we're good.
Do you? The whole cup full, but add water to it. Because my dog is nasty. That's what he likes. And then, I mean, I can just turn it. This is... It's on the bottom shelf near the corner. It's got a bunch of Halloween stuff on it. This is just gonna be a super chill live stream. And then tomorrow, I want to stream drawing some emojis or not emojis. Emotes? There we go, that's the word. I want to draw some emotes tomorrow. Dan's rushing because his work ended up going on a lot longer, which is fine. I'm having such a chill day. Hi, Mom. I'm Faye. Yeah, everything's super chill. We were talking about kayaking. My sister, my friend Chloe and I. Has anyone ever been kayaking? So I've been kayaking once with a bunch of my family because we were talking about like how alcohol sucks and it makes you sick and everything. But anyway, we got on the topic of like kayaking because there was a point where it was like I drank a hard seltzer because I was super nervous about being around like a bunch of family that I didn't really know and doing a kayaking trip that I had never been on and stuff. And I was very nervous. Hello. Have you ever been kayaking?
No.
There.
Can you hear me on the mic?
Yeah, can you hear him?
Sound check, 1, 2. Just took a shower.
Yes. So when
we went. Hear me. Okay.
When we went kayaking, or when I went kayaking with my family, I ended up with like really intense tan lines. I usually also don't sunburn, and I got a really bad sunburn like right on my chest and my shoulders. And the worst, like most prominent tan lines I've had in my whole life.
Take the beanie. Hey, thanks, Callan.
What is it?
Hear you loud and clear. Okay.
I think you're loud enough that it'll be fine.
Hi everyone. I'm Baileycream or Dan.
Yes,
or
this
Danny,
is Dan.
Depending on where you're from.
Is that a thing?
What?
Where you're from?
Well, it's like people who know me from Twitch know me as Baileycream, but then my family knows me as Danny,
that's
but
true,
then my friends know me as Dan. My dad's name is Dan, so it's very confusing if I was also a Dan.
That makes sense.
Oh, hey, Jude's here. What's up, Jude?
Hey.
Betsy's here.
Betsy's chilling in the back.
Hello. The Koala Kong. Not the king, the Kong.
Oh.
Yes.
You had a lot going on today, which was the opposite of me and Betsy.
Yeah,
we had very lazy
super
days.
Busy at work. Oh, Kate. Katie's here too.
Oh, hey.
Kate. Hello.
Which one's Kate? Use your name.
Your mate, Kate. C-Sprin.
Oh,
how you doing?
I like that you did the Kate.
A.Dev.
K8.
Hello. That's your greeting, right?
Yes, that is.
Yeah, I guess first we'll just.
You have so many notes.
Yeah, I got notes. I'm like prepared.
You're prepared.
But I think we'll just kind of start asking how everyone's doing. Just kind of check in.
Yeah. Kid Cosmic
for about 5 minutes or so, and then we can start getting into the topic. Did you change it to just chatting?
Yes.
Okay, good.
I did. And I changed the title and the notification thing.
We forgot to do that the other day.
Yeah. It still kind of worked because we were playing TKO and it was in drawing, or like it was in art. So kind of worked. But halfway through, or like more than halfway through, we ended up realizing that we were in the wrong game.
Yes. Jude, wanted to catch up and hear how the life
potato.
is. Well, that's thanks for asking. I'm doing well. Super busy at work, so that's why I was a little frazzled today. But
a .dev is named Ash.
Doing well. Okay.
I always like the name Ash.
Ash.
Ash is a cool name.
Bobby says hi. Hi, Bobby. Potato Boy, salutations.
Is
Quinn
that Scott? Is
Drac,
that my potato person?
Doing well. Baby says I'm stressed. Ooh, what's going on, baby? That's. If you want to talk about it.
Apart
you don't
from
have
like,
to.
the state of the world.
The world in general
okay.
is stressed.
It's okay to be stressed and also just like
T-Sprint says, I'm okay and mental health is okay, I think.
that's
That's
good.
good. Okay is better than bad.
Yes,
You
very true.
gotta, I think some people think that they say like, oh, I'm okay, and they think that's bad, but that can actually be a good thing.
Yeah,
Because it can always be worse.
very true.
um,
Ooh. Wax stamps, like wax seals, like those ones where you like melt the candle or the stick and then just like stamp them.
Kid Cosmic. I've never heard of Kid Cosmic.
Is it Hulu or is it Netflix? It's a cartoon show. Did you eat your food?
He ate his food.
Oh, good boy.
It's a dog here.
Look at his little ears. He's like a little like black hole. Like you can't see him except for his like.
Dog cam.
See his little eyes? See my silly boy's face? Oh, he's so cute. Look at him. You can barely see. See his little tongue.
I'm writing old letters to my friends and I have wax stamps.
Nice.
That shows help my mental health. Yeah, I'll have to check it out.
It's
seen it.
Oh, I think it's Netflix. Yes. Okay, they said it's Netflix.
Okay.
It's cool. Like I've seen a preview for it. The animation style looks really cool. I watched a preview for it last night when I was watching Scott Pilgrim.
Mm-hmm.
It seems like a good show that, like, Hilda, I think is another one. It has a very cool style.
C-Sprint Echo helps my mental health.
Yay!
That's nice. Sweet. Jude, been doing great, but so busy. Wife is 26 weeks. Ooh. Oh, that's right. You're having a baby.
That's exciting.
So that's
and stressful on both parties.
Yeah. Well, congrats again on that. Welcome, Sal Pal. Oh, Meg's here. Hi, Meg. How are you doing? Love that Scott and gang. You will love the Cosmic Kid.
Yeah, I want to see it. I think it looks good. It's one of those things. So like, this is a thing that just in terms of like mental health and the way that I approach things, I forget that I enjoy things sometimes because I don't want to start them, and a lot of it is like starting new shows because it's new and unfamiliar, and so I'm like, it's okay, I'll just watch something that I've seen a million times instead of starting something like new and trying to get reinvested because it could be bad and all this different stuff. But most of the time, especially with something like Kid Cosmic, where it's like, I know I'm gonna enjoy it, I just have to actually sit down and do it. I just have to actually sit down and start it.
Yeah. Saying Echo helps you makes me sound like a simp.
Hell yeah.
Boy.
I'll take it. I love simps.
Jude's having a boy, apparently.
Oh, you already... Wait, is that the person? They already know?
Yeah. Well, he just said boy, so I'm assuming he's having a boy.
Exciting.
Well, that's awesome. Next says, I'm good. Stressed from work, from school, but hanging in there. Yep, I think a lot of us are stressed right now.
Everyone's moving all over the place. Like,
yeah, I did know Peter's headed back to Phoenix. I was gonna text him actually.
It's like one of my college friends is moving from like up north back to Phoenix, and I'm moving from here to Washington. Fun times. I'm gonna go move to the country and eat a lot of peaches. It's gonna be great.
But yeah, thanks everyone for checking in, and anyone who's new here tonight, we're going to be talking about mental health treatment primarily.
And I feel like we should offer the disclaimer that like we're not.
Oh yes, we're not.
We're just people who experience mental health issues, not necessarily professionals at diagnosing or prescribing.
Yes, we can't diagnose anyone. We can't set up therapy for people or give medications. We're not psychiatrists or psychologists,
but
or
we can offer
anything like that.
Experiences.
We're just two people
with slightly different experiences.
With different experiences, but who have suffered mental illnesses.
Yeah.
Oh,
here's the thing. I'm gonna throw this out. Millions of
love
peaches. I love it. So yeah, I'm gonna move to the country and eat a lot of peaches. It's peach country up there too. Like peach trees actually. I need to get a peach tree.
Oh, in Washington?
Plant it. Yeah.
Oh.
I'm very excited. My cousin has a peach tree right in her front yard, and like, it's funny because her house is like, I'll see if I can do this. This is like her house, and then there's like a hill, and she planted her peach tree like here, so it's really close to the house. And she's like, oh, I can't believe I planted it there instead of like right down here where it would be like in the center and would have made sense. And so now I'm like, oh, I really want to get like fruit trees and stuff, but I'm like really aware of like I have to be very specific in my decision of where to put them on the property because
It's like Minecraft. You gotta
except you
it's a
can't
little
just
easier.
like pull it
A
up
little
and
easier
move it.
to.
It's like once you place it, that's
I
it.
wanted to check something real quick.
Go for it. Pull up.
Before.
Yeah, you can just click this.
Duplicate.
Oh, not a thing I knew it could do.
Bear with me here. I just wanted to.
You're fine. Take your time.
Here.
But yeah, it's
See, I know there's a way to add tags.
Oh.
But I'm not sure how to do it.
Oh, like
from
click
yours.
Click this.
Maybe this one.
Are you talking about these tags?
Because we can add like a mental health tag.
Okay, cool.
Mindfullness.
Nice.
LGBT.
Nice.
Put AMA in there.
Oh yeah, that's a good one.
Then...
Chatting? Or just chatting?
No. That's probably
that's fine.
Good enough. Okay, updated tag. Just because like people can use that to filter.
Nice. I like it.
Okay. So let me go back.
Oh, that's what I was gonna say. So if you if you click there. So like I have this is a subject that was some friends talked about on Twitter a long time ago. How do you feel about the idea of being broken? Because it's like there's some people with mental illness who are like, yeah, I'm broken, it's fine. And there's other people who are like, no, I'm not broken, I'm just different. And it's like, I don't know, how do you personally approach that? Like, do you feel like, because there's
we're asking you guys too.
Well, yes,
but you're asking
but
me,
I'm asking
but
you
if you want to answer,
I'm asking you
you
into the camera. Is the
okay.
thing. So like, it's like, would you consider yourself like different or like disabled to a degree? Does that make sense?
See, for me, I don't really like the word broken because it makes me feel like there's something wrong with you. And I don't think anyone really wants to feel like, oh, there's something wrong with me.
That makes sense.
So, like for me, I also don't like to say like I'm disabled. I usually just say like, I have a mental illness or,
okay,
I am bipolar or I have bipolar disorder.
That's another thing. We should probably talk about our personal diagnoses. What we've been professionally diagnosed with.
So I have bipolar disorder. That's my mental illness.
Depression and anxiety with mild ADHD, but that's a different thing.
Yeah.
I don't mind broken so much because I feel like sometimes people use it as more of a like, it's okay to be not okay kind of thing. Like, I feel like I see it in more positive contexts than negative contexts. This is actually a very good chair. Yeah, I've changed my criticism with you.
It is comfortable. So let's do a few of these. A few of you guys are saying. So C Sprint says, I feel like I'm both. I'm different, but also my life is hard. Bob Potatoes is different. C Sprint says I'm on the spectrum.
My sister is too.
Didactic Lizard, I think as long as others don't label anyone as broken, I think it's good. But sometimes
I like
people
that. Like, it's okay to identify.
Yeah, I definitely don't think you should call someone else broken. If you want to call yourself that, but I think other people can see that as an insult. That's kind of like what we were talking about a couple weeks ago with insane and crazy.
Mm-hmm.
Like trying to not use that to describe people because they could take offense to it,
Yeah.
And then, Fabi, I don't think my issues make me broken, but I do feel broken a lot. Rainey says, broken feels unfixable, so I try and use different to give myself some hope. See, I like that. That's like, you feel like you're broken, like I need to be fixed. But there's not really a fix for it, So I feel like broken is probably not the right term. At least that's how I guess
that's
about it.
See, I think that makes sense. But I also kind of like the idea of like broken because it's like, to a degree, I do have to be like fixed. Like, I need medication to function because without it, I could like die. And it's like, I need the help. Like, I need the extra boost. But there's probably a better word.
Yeah. Dad of $4. Is that Bob? I think that's Bob. Betsy's dad.
Oh, hey.
So let's see. Not broken, just depression. Has
Okay.
changed my
Gravity Man
behavior.
says I'm pretty sure haven't been diagnosed, but I'm pretty sure I have depression, anxiety, and ADHD. So like this is a thing where it's like I mean, if you think you have it, there's a good chance you might have it, and you should probably get professionally diagnosed, because this is something that like so like I've dealt with depression like my whole life, like since childhood, and I've been in like therapy and talk therapy and group therapy, whatever it is, since like I was 7, like really little, when I had like a breakdown in like 3rd grade, like in class, and it was really bad. Anyway, so I've had therapy, but I hadn't been like, so I was diagnosed with childhood depression, but I wasn't medically treated for it. Like I wasn't given any kind of like prescription medication or anything. I was just given like talk therapy. But what I really should have like had was medication. I really should have been medicated. And it wasn't until it got so bad that I was like, that it was life-threatening, that I was eventually like, I reached out to my family and was like, I need help or I'm gonna die. Like I was like, this is it. Like either I need some help with this or I'm gonna die. And I had to like reach out to my sister and be like, hey, help me with this. And she was like, okay, come live on my couch. Just live with me, and instead of don't pay rent, put that money towards like a psychiatrist and get actual help, because it was expensive. And it's one of those things where it's like America sucks. America sucks in terms of our healthcare. So it was like it cost me a lot of money to be able to be professionally diagnosed, but that wouldn't have happened without the support network of my sister being like, yes, just come, let me take care of you for a couple months while you figure your shit out.
Yeah, definitely, like having a support network can make a big difference for a lot of people.
It can be life or death, for real.
And like I do want to like answer all like
I'll let you go ahead,
but
you're better at the chat
it's
than
gonna
I
be
am,
hard to
'cause
like
there's
keep
more.
up with. So if you say something and you really want us to hear it, and we don't catch it, just feel free to say it again, later on. So I personally prefer the term damaged. Like it'll never be the same. You can make it doable.
That's not bad.
Didactic lizard.
I kind of like that, because that's not necessarily. Yeah, like broken does have more of a like fix it approach compared to like damaged or different. That makes sense.
Self-pal, bipolar, ADHD, and anxiety. I don't call myself broken generally. There's time a few years ago I was dealing with grief. So it was broken because it was so bad, and since then I've gotten that level fixed. Well, that's good that you've gotten it fixed.
Hi. Do you just see the little tongue? Look on screen of him.
I know.
Do you see
his eye?
Creepy little eyes.
That's Echo's dog Ben.
That's Ben.
Wasn't
professionally diagnosed.
But I know I have this, but I have algophobia.
Algophobia or agoraphobia?
It's probably a different one.
Algophobia. I don't know. I've never heard that one.
Rayla, so I'm struggling to find a therapist because I was turned 18 and I outgrew the clinic I was currently at. Yeah, we are going to talk about therapy tonight.
Like, mental health in America. That was another thing that was like really difficult. Was like all of my talk therapy stuff stopped.
Fear of pain is algophobia.
Oh, that makes sense. Yeah, my
like physical pain.
Yeah, okay. My talk therapy stopped after I had graduated 8th grade, and it was like, so like throughout high school, I believe I had like no mental help whatsoever.
Yeah, and this is, so Max says, I didn't get diagnosed until my 3rd year of college, but I had symptoms in high school. Yeah, so I probably had symptoms in high school too, thinking back on it. But I wasn't diagnosed until I was 25, so like 3 years out of college.
So does bipolar build up and then just have like an attack, kind of like
that's kind of like
bladder attack to a degree?
Yeah, I mean that's kind of like a telltale like symptom of it. Is that for bipolar in general, you have you have the mania side of things, like being having a manic episode is what happened to me originally, and I was hospitalized for it. And then there's also, you can have a depressive episode and you can be, depressed and suicidal. So I've been there too. So you get best of both worlds with bipolar,
You get the ups
get
and the downs.
the high and the anxiety, and then the low and the depression. And kind of the main thing you try to do to treat bipolar is just to kind of get your mood stabilized and get you kind of, level. Obviously, like, you always have highs and lows. Even just in general, people
with bipolar medication. So with what is it? Like the medication that I'm on, usually depression and anxiety kind of go hand in hand, and I feel like part of it is that like highs and lows sort of thing. But it's like my anxiety is very mild, but the SSRIs that I take also treat anxiety, so it's like one medication which covers both. Like even like I have a friend who has severe anxiety with mild depression, and she takes roughly the same medication that I do because it treats both of those symptoms. Do you have, like, does bipolar have different medication for like highs and lows, or does it?
Typically, no. They will just give you kind of like a general like mood stabilizer.
Okay.
They do have like specific medication. I don't know too much about all of it. But I wanted to talk about, so also there's a lot of different types of bipolar as well. That's true. I have bipolar 1, but there's also...
I didn't know that.
So bipolar 1 is kind of like the extreme mood swings of like, mania and depression. Bipolar 2 is more like you're kind of stuck in like hypomania or mild depression for extended periods of time, rather than getting like the swings. So
see,
and then we'll touch on the different medications and the treatment, because that's kind of what our focus tonight is.
Callan says I'm taking an SSRI for I think that's how I say it. Callan. I'm taking an SSRI for high anxiety, low depression. Yeah, I know a couple people who are the same.
And I want to answer Jude real quick. What would you say your friends to do to support you that you would say now, having lived with this? It's kind of tough because everyone's different, right?
It depends on, like, well, for starters, it depends on your friend's comfort level as well. Like, it helps to be open. I kind of like blunt conversations.
Yeah.
To a degree where you're like, let's just have a blunt conversation really quick.
Well, I heard something the other day that it's like, do you want comfort or solutions? Or something like, it was something like that.
What is it, like, empathy, where it's like relation.
Yeah.
Have you ever seen that thing where it's like empathy versus sympathy, where it's like empathy is when someone can be like, oh yeah, I've been there, this really sucked, that's what it was like for me, and sympathy is like, well, that sucks, because it's like they can't relate.
Oh yeah.
So it's like that's another thing where it's like this is the thing I talked about, I think, when we were on your live stream, but like I have a friend who, there was a point where I was having like, I went like 2 days without my medication because I was like, there was a gap in between my refill, whatever, and I just ended up having like a small suicidal episode. And there was a point where we were like in the car, I was in the car with my friend, and I just said like, so I'm having like a suicidal episode, and I keep thinking about like jumping out of the car and doing all these like horrible things. It'll pass, but just pretend it's not happening. But I was like, I need you to know this is happening. That's what's happening in my brain right now, is that I'm having a mental issue. And it was a lot to unload on them at the time. But I was like, I need you to know that this is what's happening right now. Because it's like if you were having like a heart attack, you'd have to be like, so I'm having a heart attack right now. Things need to happen.
Yeah.
And it's like, there's nothing that can be done about it. It's just a thing that is currently happening. And the thing that I needed in that moment was just like maintenance of normalcy, whatever. So I was like, what I just need right now is like for you to know that it's happening, just so that you have the heads up and like you don't accidentally do something that would, I don't know, like push me over the edge. But I feel like asking someone to pretend it's not happening and to try and just continue being normal is a very low ask of someone, because I feel like it's easier for people.
It's also tough because a lot of people, I've known.
Hi, two more fish.
In my case, hey, what's up, Steve? That's my pal Steve. Well, just to contribute to the conversation, Steve has really bad ADHD. So that's kind of his
Ah.
field. Why are we dropping frames?
Are we? It might be your internet.
It could be in the internet. Welcome, Joyless Fire. Hi, Echo. Hi, Echo's friend.
Hi, Blue Ivy.
Hi, Alice Lowell. There we go.
Lowell.
And hi, Blue Ivy Animation. Welcome in. Sorry, I think we're stable. Sorry if the
it's lagging.
If we have any stream problems, if you notice things are lagging or dropping or you can't hear us, just let us know, because otherwise we don't know.
Yeah.
And yes, ADHD can suck it. What were we talking about before?
To your friends.
Oh yeah, so like your support network. I think a lot of times people want to help, but they don't know how, and sometimes like they'll try to help, and it might make it worse, or it might like kind of push you away. So I found. So someone said, "Do you think that's why mentally ill people often flow together, because it's easier to understand each other?"
Yeah, there's like a level of empathy involved.
I think also just like finding a support group of people who have experience. It's like you don't really know something fully until you experience it, right? So like you can read all about depression and like learn it, but actually like experiencing it is like a different level of understanding that you wouldn't get just from reading a book, you know? It's kind of a difference between like informative learning or experiential learning.
Have you ever heard that one? There's like a thing in philosophy where it's like, it's about a girl who lives in a black and white room with a black and white TV and lots of books, and she spends her entire life learning about the color red. So she knows everything about it. She knows like the wavelength and what things are red and what, like everything that red is, but she's never experienced or seen red. And it's like, and then it's like she walks outside and sees a rose bush, and it's like, does she know what red is? If she's never experienced it, if she's never actually taken in red with her eyes and perceived it with her brain, does she actually know what red is? And it's like, I think that's similar, where it's like that level of
thing to just a different level of understanding. So I think having like a support group, like for me, like I'm a Redditor, so I'm on the bipolar subreddit. There's a lot of, I mean, pretty much for people who have bipolar, there's a group, for that. Let's just touch on some of these comments here. Grimlock Blythe, welcome in. Good to see you here. I have ADHD, but it's gotten worse with stress in later years. That can happen. That's why you always want to be monitoring, your mood or your mental illness and how effective your medication is. I feel like
ADHD is one of those things where it's like it's a lot like, what's the other one that starts with an A? Autism, that like people are learning more about now than previously.
Yeah.
Where it's like it's getting better.
Seaspring wants a sandwich, so go.
Me too.
Go, if you want that sandwich, go for it, Seaspring. Go get yourself a toasted sandwich. Blooming the artist, really cool. You're doing live stream. I was diagnosed with bipolar just over a month ago. Okay, so that's really recent. I don't personally know anyone else who has it, and I don't follow any creators who have it. So even though I know a lot of other people who have it, I've been feeling really alone. It's really cool to see someone this stream has bipolar as well. Well, thank you for a compliment.
How did you find out about it? If you don't mind me asking.
Oh, you're asking that.
Like,
yeah. So, like, did you
like
have
working with someone
did you have like a manic episode, or was it?
Were you prepared?
Something else? Is it something that kind of like was gradual, or did it kind of happen all at once? Because that's what happened to me. Is it was like all at once, like just this shit show, and I spiraled into a manic episode. So yeah. Let's see. Potato Boy, part of that could also be that people would share how to handle the depression, like coping mechanisms. It's true.
It sucks, like, when you're going through it, because, like, sometimes you don't know, like, even you don't know how to handle it. Like, you don't know what other people should be doing around you, so you can't guide them on how to help take care of you. Does that make sense?
Yeah.
Which sucks. Mental illness can be difficult.
And I'm just going to do my plug for the night.
Do it. Do it.
So we're on Echo's channel right now. Here's my channel. Feel free to follow me as well. We'll kind of be right now we're just alternating between our two channels. For these mental health talks. So the next one will probably be on my channel either next week or the week after.
And if there's any like topics you specifically want us to touch on next time as well, please throw that out.
Yeah, we're always open to suggestions. I do have a couple questions here, like for tonight.
My dog is pushing me over.
That we can get to later. ADHD. Manifests in a lot of different ways. Has a lot of comorbidities. Lots of ADHD is internalized as anxiety.
That would make sense towards like my issues.
I have ADHD and autism, though I'm much lower on the spectrum than a lot of people, but still causes me to not understand a lot of things, and sometimes people dumb it down for me and I get very frustrated. That can be annoying. I mean, I'm not on the spectrum, but I can see how that could be irritating.
It could feel condescending.
Like, oh, this person has autism, so they're gonna like drop it way down instead of just like treating you like a normal person, right? Therapist says I'm having signs of bipolar. I'm hoping to get a diagnosis soon, but wait lists are sucky. That is sucky.
Oh, are you in the UK? Because I know that's an issue. So like they have, although they have free healthcare and it's really great, it's very need based. So everything has a lot of wait lists. So it's like, everyone's needs are met, but they're met pretty late along as far out as they can, which sucks.
Yeah,
but
it's probably cheaper
affordable.
Than
US. On the upside, I think they have the option to go private, whereas here we don't. Oh, okay.
I've been having worsening episodes, and then so this is the guy who had bipolar. Blumenthal artist. There we go. Been having worsening episodes, and then I got a therapist who told me to go to my doctor, and he rendered me to a psychiatrist who diagnosed me and put me on Lamictal. Okay. Yeah. Not familiar with that medication. I'm on what's it called? Seroquel or quetiapine, and then I'm also on oxcarbazepine. Sexuality and gender identity? Question mark.
Of us in general?
Oh, of us?
Asexual cis woman. I'm
a just generic straight cis
white
man.
Guy.
Yep. What things do I often do on my Twitch? I play video games a lot, and we just recently started doing these mental health streams, so I'll definitely be doing that in the future. We have Wednesdays right now.
On Wednesdays, we do mental health stuff.
Yeah. Yeah, I'm thinking like Wacky Wednesdays doesn't really work. We need to come up with like an acronym.
Working on it Wednesdays.
Working on it Wednesdays. But I play a lot of like Minecraft. Echo does too. And then I play like World of Warcraft and RuneScape and stuff.
Genshin recently.
Oh yeah, I did start Genshin Impact.
I need to do that. Hey, also an ace cis lady.
Nice.
Hello. Yeah.
Cis het white male. Get him. Yeah.
Yeah, I specifically gray ace, pan gray ace. Just asexual, it's easier.
Okay, Potato Boy, thanks for stopping by.
Bye, thanks for hanging out.
As one on the spectrum, I'm also annoyed with handicaps. Okay, so we have a few people on the spectrum here. That's good. Oops.
I believe in you.
Is there something for a name where I like giving hugs and loving touches but hate getting them from people? Probably. I know a lot of people who are on the spectrum have difficulty with
I think they might be talking about sexuality.
Oh.
But I could be wrong.
Maybe. I'm not sure.
There is a name for it. I don't know what it is.
There's a 6-month wait list for people who are in crisis in the UK. That is...
Yeah. It sucks because like they keep gutting the NHS and like I have British friends. Like I have one friend who has like lots of crazy kidney problems and people who are on like wait lists for mental health things because they have to like everything is so need based and it's like their funds keep getting cut, so they just kind of push everyone off to as far out as they can, just because everything is very need based, which it's like it's meeting like based on the resources that they have.
And I wanted to talk about that too. Probably like
go for it.
Go for the thing. I'm just gonna get the last bit of chat out here, and then we're gonna move to our kind of main discussion. Any pan NB? It's an NB.
NB is non-binary.
Oh, okay. Sorry, I didn't know.
NB.
Oh,
non-binary,
Gotcha.
but NB is like a
okay.
abbreviation.
Hey, there's another Dax Nico. Welcome in. I'm Ace and Pan Gray.
Hey,
Arrow.
Pan Gray Arrow. Nice. I like it.
He's can't work a real job. He's on autism, currently fighting for SSI. Not sure what SSI is.
SSRI?
Maybe S.
Like
SS, probably
SSRI?
SSRI.
What does it say? Currently fighting for SSI.
Was there no spade emoji? Ace?
Right. Oh, there is. I think there is.
Is there?
I thought there was.
Well, maybe on Twitch.
Oh. Oh, maybe I should.
Callan, I'm so happy you're streaming frequently. Echo, you're the reason I identify finally as Ace and understand that.
See, you don't.
Sorry.
There's not enough representation, and so you just think like, oh shit, I'm broken. I don't get it.
Yeah, I watched you when mental health is low, so you're helping the now. The paper's unfortunate. Got an old school setup ready to stream. Nice. Nobody asked, but I'm also trans femme. Okay.
Hell yeah.
I mean, and also guys, this is a safe space that we're making here. We're not going to tolerate any bigotry or sexism.
Yeah,
you'll just get
Wizard.
timed out or banned. So
Didactic Wizard says the government would rather clap for the NHS instead of funding it. Yeah, I thought that was so stupid. Like the whole clap for the NHS thing. It's like fund them. Pour your money into your healthcare system.
Social Security benefits. That's what that was.
Oh,
Social
okay,
Security.
that makes sense.
Okay. There's a spade.
Yeah, see, I knew there was one.
Would you rather pay a small fortune or wait 6 months for help?
Oh,
Yeah,
I like that.
That's
that flag.
A tough decision,
Is that from a specific channel or is that just a general one? I wonder. Is that just like a Twitch?
That's one of the Pride ones.
Okay, cool. So that's just a general Twitch one. Nice.
Well, not everyone has them. There's like during like Pride Month, they had like a promotion where a bunch of people would get those emotes. They probably are gonna do it like every Pride Month, I would assume.
That makes sense. I like that.
All right, so let's get talking about mental health treatment. So I kind of have a lot here, but I will try to break it down. So I want to go over the different types of treatment. So we've got medication, therapy, exercise, support network, alternatives, which can be things like meditation, mindfulness, prayer, that kind of thing. And then I also wanted to touch on immediate treatment versus long term. So
holistic route.
Holistic would probably
St.
be
John's wort and ashwagandha and stuff like that.
What's that called? Homeopathy.
Homeopathy.
I think.
Which is like the more natural, where it's like, if anything happened and I couldn't synthesize this SSRI, I can grow St. John's wort.
Yes, and then the last thing also is bad treatment. So like self-medication,
crystals,
things that you shouldn't do. Things like that.
The placebo effect is a powerful thing. So if you can trick yourself into believing that something will work.
Don't forget the most effective method.
Exorcism. Yeah. That was a thing. I had an exorcism before I got on medication.
We can talk about that.
Terrible.
So sad I have to leave and right when you get to the big things, but it's cool for sure. Hey, no worries. This will be recorded, so
you should be able to still access
you can come back
on this channel.
Yeah, the VOD will be saved, and then eventually we're gonna upload them all to YouTube. So just make sure to follow and come back and you'll be able to watch it if you want. So the first thing we're going to talk about here is medication. So there's a bunch of different types of medication. The thing that sucks with most medications is that it's
side effects.
Well, that's one thing, yeah, and also it's a lot of it's trial and error. So it's not like, I wish that you could just go to the doctor and they just take this like fancy scanner.
Like just
and
scan your brain and be
all
like,
right, here's your
yes,
medication. Oh, thanks, doc. And then you're fine.
No,
it's
your
like,
brain isn't processing
you go and your
serotonin.
doc's like, well, it might be this or it might be that. So let's try this for a week, and then you try it. You go home, and then you're like,
a month later,
oh shit, I want to kill myself even more now. And then you call the doc, and then you get hospitalized, and then they're like, okay, let's go to this medication. And then you take that medication.
Yours is even more experimental than mine.
Yeah,
mine wasn't too bad. Mine, the first one that I was prescribed worked fine. We ended up having to up the dose,
right.
But
that's another thing. The dosage can change.
Yeah,
so they can try different dosages, and then also there's drug interactions between different types of drugs.
Mm-hmm.
That like if you take this with this, it might have a different effect than this with that. And it's all trial and error for the most part. At least for me, that's been my experience. And I'm on stuff now that is like, I think, pretty good for the most part. But I have a buddy of mine who also has bipolar, and it took him 10 years to find the right medication.
I've debated trying another one because I know that the one that I'm on works, but I feel like there's always a chance that another one could work better.
Oh, so you said frames
yes,
drop.
And the grapefruits thing.
Okay, we'll try to keep an eye. It might just be the internet. I'm not sure, but
it might be.
It looks like it's okay for now.
It's in the green. I think it's okay.
So like I was saying, it's like trial and error. But usually they'll find something that works. It depends also on your mental illness or what symptoms you've been experiencing.
And how bad it is.
And how bad it is, the extent of it, Like someone with depression, they could be suicidal, and they could, it could be debilitating, or it could just be mild depression where, you're just kind of disinterested in a lot of things you used to be interested in. There's all different levels to it, and each medication will have a different effect. So the types of medications, there's antidepressants, which are generally prescribed.
SSRIs.
Yes, so SSRIs and SNRIs.
There's, what is that, serotonin?
So selective serotonin reuptake inhibitors is SSRI.
Mm-hmm.
And SNRI is serotonin and
norepinephrine
reuptake inhibitors. Those are usually SSRI is the most common antidepressants, and then there's also bupropion, and I'm not too familiar with that one. I'm not familiar with that one.
I know the norepinephrine. See, this is the thing where it's like I could try this because it also affects your norepinephrine versus the other one does not.
Mm-hmm. So you can because you're on an antidepressant now.
Yes.
So maybe you could talk about that a little bit.
So I'm on an SSRI, which is the generic version of Lexapro, and it's there's an EMP. Oh gosh, my brain is just saying norepinephrine, and that's not what it is. But yeah, it's the generic version of Lexapro. And I remember, it's one of those. So when you first start taking an SSRI, you have to take it from very small doses to slowly bigger doses. And I remember the first 5 days just feeling weird. I remember I could feel my brain changing, and I couldn't, I really can't completely put it into words, but I could just feel my brain changing and being different. And now that I'm on an SSRI, I feel like I can tell when I'm having a suicidal episode. Oh, hello. Thank you.
Samurai Screams? Samurai Screams.
Thank you for following.
Hope we got that right.
We tried. But yeah, so when I first started taking it, it made my brain feel just really weird. And then after I ended up on it, it kind of helped me externalize suicidal episodes and really bad depressive episodes where I can be
Hold on, let me close out.
It made me it helped me realize when I was experiencing things because of my depression and not because I sincerely felt certain ways.
I'm gonna just close out of my computer just in case.
Okay, I'll try disconnecting this from the internet as well. Boop, 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 boop.
Guessing a Mac doesn't have any.
No, I don't think so. It might actually. Hold on.
Macs are.
They require lots of converters. They require converters because things are. No, it has one. It has one.
Because we could plug in.
Oh, what a good boy! Yes, go ahead and plug it in. Yeah.
Okay.
Hold on, I'm gonna move this. Jacking into the matrix.
Jacking into the
Guitar.
matrix.
You see it? Right, it's the furthest one on the side.
Oh, it's
so bright.
Oh, bear with us.
Give me a sec. Are we gonna change the internet
it's plugged
settings?
in. Maybe. Hopefully this doesn't screw things.
Yeah, we're gonna find out. We'll see if
this got tangled. Okay, there we go.
All
right, we good. I think.
Should I like flip this? That might be better.
Is that better?
Let's find out. Yes, that's much better.
Oh,
geez, we were like
wow, that was
really washed out. Okay, that works.
All right, cool.
Doot.
Dude, oh, Sammy Ice Cream's with a rating with a party of 16.
Oh, yeah, hello.
Oh, thank you. Welcome, Raiders.
Welcome.
I'm Baileycream or
I'm
Dan.
Echo.
This
Gillette's
is Echo.
Echo is weird. I lost your notes.
Welcome. Thank you, Star Dreamer, for the follow.
Yes.
We're talking about mental health treatment, and
if you're new here,
right
I
now,
have depression, anxiety, and mild ADHD, and you?
I have bipolar disorder, and we're discussing medications
and
currently.
The treatments we've experienced, therapy, psychology, medication, all the things.
Yes.
Yes. I mostly do art here also, just warning you.
Yes, she's more of an art. Oh, thanks, Shizurivera, for the follow.
Nice.
So I'm
Shizurivera?
Escitalopram.
Yes,
You got
escitalopram. That is what it's called.
Okay, Bam Snicks with the follow. Thank you.
Hell yeah. Escitalopram is the one that I take, which is like the generic Lexapro. And it works the same and it's less expensive.
Sometimes drop frames are because your bit rate's too high or the encoder you're using isn't strong enough. Okay,
Maybe.
we'll have to play with that.
We'll have to play with it.
Echo's a streamer noob, so
I'm like
trying
such
to
a baby streamer.
trying to help
like
her.
at least I'm like on my feet, but I'm not running yet.
Yeah, I've been streaming for about a year, but not consistently.
See, I've been streaming off and on every now and then for fun, so I know some things, but you've actually done research on how to do things.
Doot. Oh, Jude, thanks for the follow. And then I'll throw one more plug.
Yeah, throw
for
your
all
channel
the Raiders in here.
So we do these on Wednesdays. We
so
usually
here's my
switch
channel.
back and forth between my
feel free
channel and his channel.
to follow that.
Yay!
Another follow. Wow, so many follows.
Alexandria. I tried.
I've been watching Echo
really
on. I'll let you do that.
Ooh, I've been watching Echo on YouTube for a long time, so when I saw her on Twitch, I went, oh, hey! But I'm happy to help in doing it a while. Nice! That would be cool. Frank
cool.
the Pegasus, that would be very useful.
You got a little check mark.
Ooh, fancy.
Is that for...
Does that mean he's a partner?
I think, maybe.
That's neat.
But thanks for all the doots. Oh, you got another follow?
Ooh, Teddy.
So many
it
follows.
disappeared. Teddy something. Thank you, Teddy.
So yeah, so we were talking about antidepressants.
And Libby Girl 007. Yes, we were talking about antidepressants and how, like, sometimes the getting on the medication and stuff can be a little bit experimental. I got kind of lucky.
Alex, sorry.
Alex. That's
Andre.
Very clever
Andre.
spelling.
Yeah, it's
Alexandre.
Another follow.
Nice. Ooh, wait, Cammy Bear. Cammy Bear 123. That's a cute username. But yeah, so I've been on my SSRIs since I think 2016. It was when I got back, so 2017 when I got back from London. So yeah, I think it's been in, because that was actually why I had to quit my master's degree program. And I think part of it, like, I was warned that, like, going from, like, Arizona summer to, like, UK winter with gray skies. Hello, Penny the Bat Dog. Oh, I like your username. That they were like, oh, so a lot of people get depressed when they move to the UK from America because there's no sun over there. And I was like, oh, okay, I'll be fine. I've been sad my whole life. And it like pushed me over the freaking edge, and I ended up having to like quit my master's degree program and be like, I'm gonna die. I need help. And then came back to America and got formally diagnosed with depression and actually on medication, which I had to talk to a psychiatrist for, not a therapist. That's another thing. So a talk therapist is like the person who you like sit down and talk with, and they try and like help you work through your mental issues in like a more brain way.
Yeah, and that's what I was going to get to next, actually. Well, after we get through with medication, we're going to talk about therapy. And specifically, I wanted to touch on cognitive behavioral therapy, or CBT is the method that most therapists use. But I did want to say hi to Shizurivera.
Shizu Rivera. Shizu?
Okay.
Shizu Rivera?
Maybe.
I'm going to hope.
Welcome in, Viral Crush. Someone who knows nothing, could you dumb it down? I've been one thing for 3 years. I'm not sure what you mean. I've been one thing for 3 years. Maybe elaborate on that a little bit.
Yes. Are you talking about the medications or the?
Yeah.
Anyway, go ahead and
just let us know. So besides antidepressants, so those are generally used to treat people with depression. But if you have
anxiety, like oftentimes.
Yeah. Well, there's also anti-anxiety medications, which I have on here as well. I don't really have much else, but there's antidepressants, anti-anxiety. The thing with me and bipolar is I can't take antidepressants unless they're specific for like bipolar.
Is there a specific?
Because the reason is because bipolar, you're balancing between the depressive state and the manic state, and antidepressants can push you into a manic state.
That makes sense.
That's why generally they don't want to give you antidepressants when you have bipolar.
Is mania related to serotonin uptake? Is it related to like an overabsorption of serotonin?
I'm not sure the exact like chemical, I guess, characteristics of bipolar disorder. I just know more of like the treatment and like what I've been doing. I just know that was because I had depression at one point with bipolar, and I asked my doctor like, well, what about antidepressants? And he's like, well, we don't really want to keep you on that or put you on that because it can push you into mania, and that's what we're trying to avoid. So now I'm on a mood stabilizer and an antipsychotic.
Okay. So are you on 2 medications for it? Okay.
Sort of. So I'm on.
What sort of?
I'm on one. Yeah, I'm on 2 medications. One is more the mood stabilizer. The other is antipsychotic, but can also help me sleep.
Okay, that's like the trazodone. So originally, like I'm on. This makes me sad. I used to be so good at sleeping. That was one of the things that was like sleeping is my superpower, because I could literally just like lay down and fall asleep. There was none of that like being awake in your bed for 3 hours nonsense until I started antidepressants. And it messed up my sleep schedule. And now, like, I'm not a morning person as well as I was. And, like, so my sleeping is kind of just all over the place. But originally, they prescribed me trazodone. Hello, Chirpy Art. Hello, thank you, welcome. But yeah, so they gave me trazodone, which is a different antidepressant. But it makes you sleepy, so it's generally prescribed to people who, like, it's a common issue that your sleep schedule gets messed up because of SSRIs. So it's usually prescribed as a sleep medication, as a pair with that. But the problem was that it made me sleep too much, to the point where it's like I would fall asleep, but then I'd sleep until like 3 in the afternoon. So I had to stop taking it. But yeah, that sounds like that's kind of what what your antipsychotic one is for, where it's like a paired medication that helps you sleep. Yeah,
but it also helps to like prevent mania is the main reason for that one.
Nice.
And in regards, so hospitalization's another thing. So
you've actually experienced that.
I was going to talk between like differentiating between immediate treatment and long-term treatment. So these medications we've been talking about are kind of more long-term, but like it could be prescribed to you immediately if you're in a crisis situation. Um, so I think we covered all the medications, antidepressants, anti-anxiety. Before I get into the rest of it, I guess we could talk about immediate like help or
Is
treatment.
James taken off? Bye, James.
So a big one
Yes.
in, at least we're in the U.S. So if you have, I guess kind of the biggest um, okay, we got to do something about this is when it comes to suicide.
Yeah, we're very serious
Or
about suicide in the
suicidal
US.
ideation or homicidal ideation. Anything that threatens, the life of yourself or others, that is basically a crisis situation. In the U.S., there's a lot of different resources. The suicide hotline is one of the big ones out there. It's completely free to call. Besides that, in our area, and this depends on where you live. We're in Arizona, but we have something here that's called the crisis hotline. It's kind of like the suicide hotline, except it covers more than like just suicide. And so you can call that, and they'll actually send a crisis team like to your house, like for free.
Yeah, don't they?
So we've done that before. So I have like some firsthand experience with that. And then they also have a warm line. So the hotline's more like you're in a crisis right now. The warm line is more like I might be
approaching
a crisis, or I want to prevent a crisis from happening. Then you call the warm line. And then of course, if you do have plans to commit suicide or anything serious like that, you can take so like I'll give a little backstory. When I was first diagnosed with bipolar disorder, like I had like suicidal ideation is what the technical term, which basically just means like you've been thinking about suicide, or like are thinking about planning on killing yourself, that kind of thing. And so my wife didn't really know where to take me, and we kind of like she was calling all kinds of different places, and then we finally found this this place called Connections, which is it was like a mental health hospital basically, but it wasn't like a long term. It was more like a 1 day thing.
Okay.
So I went in there, they checked me in, and I was there overnight for like a study. And then the next day, they shipped me out to another mental health hospital that was more like the long term. So I've experience with that, with being hospitalized for bipolar disorder. Definitely sucked.
That was a really crazy week.
Yeah,
like
definitely.
Yeah, that was one of the things that I ended up I hadn't talked to Betsy in months, really long time.
That's
and
my
then,
wife, Betsy.
Yeah, and then you sent me a message at 3 a.m. that was I have big ideas for a project you should get in on, and I was like, it's 3 a.m. but okay.
Yeah,
and then it was just really weird text that it was slightly weird because I had no idea what was going on this end. So I had no idea. It was just this is okay, all right. Okay, sure. Because I was I'm a graphic designer. It makes sense, I guess. And then Betsy reached out to me a couple days later and was like, I don't know what's going on. Please help me understand.
Yeah, so that was definitely really scary for her and for me, but mostly for her.
I mean, secondhand me, because I was
yeah.
Okay.
One of the, and here, let me.
Yeah.
I was gonna look up just the.
Go for it. Yeah, it was slightly because for me it was very secondhand because it's I wasn't really there for any of it, but it was after, I think it was after you were getting treatment and help that Betsy and I met at a Starbucks, and we were just talking, and she was going over everything that happened, and I was wow, that happened.
Yeah, so I was in a manic episode, and it's characterized by abnormally elevated or irritated mood, intense energy, racing thoughts, other extreme and exaggerated behaviors. You can also experience psychosis, which includes hallucinations, delusions, a separation from reality. People who experience manic episodes, it's also very euphoric for them. Um, you
That
feel like
like
you're like at top of the world, like the most important person in the whole
you
universe,
can do
and you can do
anything,
anything, and like you're super motivated, but then like you also don't sleep at all, so you're like
where you're burning yourself out.
yeah, you're basically burning yourself out, like,
See, that's kind of what like that
and
reminds me of
like
what
being extremely social, hyper
hyperfixation
active.
for ADHD. This is a thing. Okay, so like this is one of the small things that made me realize I have ADHD and started talking, or mild ADHD, and talking to my therapist. My channel is just me getting hyperfixated on things and then making a video about it. And that's a huge symptom of ADHD, is hyperfixation. My job just works with it. But yeah, you were saying.
And so those are the symptoms of the manic episode. That's what I experienced, and then I had to be hospitalized. Then I came home. This is kind of like summarizing.
So did it come like were you hospitalized between the manic and depressive episodes, or did you have a
I had the
depressive
manic episode. I was hospitalized, and then I came home. I came down from the mania, with the help of medication, therapy, all that. But then I went into depression. I was in depression for several months, and eventually got out of it. But yeah, I've kind of been through a lot. I did want to touch on Viral Crush. What's TW? Oh, trigger warning.
Oh, yeah. Wait, what's the trigger warning for? What does it say?
So trigger warning, failed suicide attempt.
So maybe hit mute, and then I'll hold up my hand when it's safe if you want to.
Well, they can read it too.
I mean in the chat.
Okay. Anyway, I tried to unalive myself a month ago. I'm doing better, but I'm having trouble grappling with having less control over something. Any advice for trying to draw the line between independence and accepting help? First of all, thank you so much for sharing that. It's very brave of you to be able to discuss this, in front of us and a lot of people here. I guess you can move the hand.
I mean, yeah, I can.
So I'm glad that you're doing better. You say you're having trouble grappling with having less control over something. Advice for drawing the line between independence and accepting help. So I think you can still be independent, and accept help. Like, you don't have to like draw the line and say, okay, I'm going to be independent and do everything on my own. And there's a difference between that and accepting help because you need it.
And sometimes you have to accept help to get your independence back.
Yeah, and that was one thing that was for me really tough when I experienced all this stuff. Is like I feel like I lost control.
Yeah,
and
it was the same for me.
And like, and I felt like,
yay, thank you, Koshoa.
I felt like it was hard to get back into control, and I felt like I don't want to be stuck on medication the rest of my life, and I don't want to
be dependent,
be like tied down. Like, I just want to live and be,
especially because you had normality before that. For me, I always had, like, I had childhood depression. I had depression my whole life, so it went from that to slightly better, whereas you were trying to get back to what you had before. Does that make sense?
Yeah, and that was a tough thing for me too. Is like I kept comparing myself, which is a terrible thing to do, by the way, to how I was before and where I was now, and I was never gonna get there. So I was trying to like show the hand motions.
You're good.
And I kept comparing myself, and I kept like feeling terrible because I'm like, well, I'm not who I used to be, and I finally just had to accept.
Oh yay! Thank you.
Oh, thanks for the cheer.
Pray love.
I finally had to accept that, like, okay, I'm changed now. I'm different. I'm never gonna get back to where I was before, but I've kind of accepted that and accepted like my situation. So I think probably
and you can get better than what you were at your lowest.
Yeah, and I don't know if Meg is still here, but I remember she said like when she started taking medication, she thought of it as like a drop, something weighing you down. But now she sees it as being an anchor, as something that like holds you
Yeah.
to yourself.
Medication is great. Like, knowing that there is actually something physically different about my brain that makes me feel this way is a great way to kind of like externalize my depression to a degree, where it's like, okay, this isn't me, this is just my brain. This is, so like when I'm having a depressive episode because I'm like 2 days between medication or something, I can be like, okay, this isn't me, this is just my brain being stupid, and I know that, like, even though I feel like I want to die, I'm not gonna feel this way in like a week for sure. I'm gonna be able to get, like, this is a thing I can pass through. I just have to pass through it, and it sucks in the meantime.
And I do want to
good night, Alice. Sorry.
Yeah. Starlight Rose, a big thing that helped me grapple with that line between independence and help is remembering that accepting help is something that you have control over. It's your choice and your choice alone to get any extra resources or set up a support system. I kind of see my support system as an extension of my own agency. That is a good way to look at it. That like you're not in it alone. As much as you think that you are, even if, even like, I think a lot of people think like, I want to do this myself. I don't want anyone else to help. But you're not in it alone. Like what you do and who you are affects everyone around you, everyone that you know. And that might be something you might not, realize. I know for me, definitely, it was tough for me. And that's kind of what helped me see, like, okay, I'm not just doing this for me. I'm doing it for other people too. I'm doing it for, my wife, my family, my friends, to get better, because that's, what they want for me, and that's what I want for myself, and that's what I'm gonna do, to be, good and stable, and the best I can be. So
to a degree, asking for help is a way of taking control over the situation, because it's like, I mean, you're making a choice to like reach out to someone and say like, hey, help me because I need your help, and it's like, at that point, they can say yes or no, and then you can move on to the next person. It's like you have to take control of that situation to be able to reach out to them in the first place and find help. It's just you finding a resource, kind of. Yeah.
Hello, Madam Asylum. I like the name.
Oh, I like that. Yeah.
For me, the actual validation when I was 17 of being given meds for anxiety helped a lot in like an understanding that it wasn't normal kind of way. I mean,
it's like, it really helps you externalize. Like once you experience life normally, like once, like, it reminds me of like getting my gallbladder out. It's like I used to wake up every single morning with stomach aches, and I was like, this is the human condition, oh well. And then when my gallbladder was removed, I would wake up and there was no more stomach aches. And I was like, this is how humans live? This is norm. This is normal. I had no idea it was supposed to be this way. Mm-hmm. And it's like, once you realize what it's supposed to be like, it changes, it shifts the entire way that you think of it.
And also like, with like, a lot of times people can get like pigeonholed into thinking like, okay, well, this happened to me, so this is normal. So this is normal for me, and you automatically assume, okay, it must be normal for everyone else. That was something that that like, I mean, I don't want to get into like politics and stuff, but like the people around you and who you associate yourself with, you think, okay, well, that's how the whole world is, right? But it's really not. Everyone has their own different experience. People have dealt with trauma. People have dealt with
PTSD
abuse,
is another
PTSD, one. Mental illness, all this stuff that you just don't know about, and you wouldn't know about just like seeing someone on the side of the street, or someone that you just met.
Panthony.
Okay. Oh yeah. So
is that the way that you described your mania?
No. That's I did say that once. So like, remember how I said before, I was trying to compare myself to how I was before?
Yes.
And so now, I think at this point I'm probably 3.0, but I would say like, okay, I'm not who I was before, but now I'm, Dan 2.0, right? Like I'm the next version, like an update.
I feel
instead of thinking of like, well, I'm not going to go back to that old version because that was unstable. right? That had a lot of bugs that we had to fix. So, you know, kind of looking at it from like a programming standpoint, like, okay, I just got updated. So now I'm 2.0.
Yeah.
And then last year I had another manic episode. And so now I guess I'm 3.0, right? You know, I've just been updated. And I think that's kind of maybe a good way to, I mean, that's a good way to look at it for me.
It's one of those things where it's like, this is just going to be part of our lives in terms of aging, like forever. It's like, I just turned 30 like a week ago. And I'm weirdly like, up to 30 sucks because you're like, oh, I'm going to be turning 30. I'll never be 20s again, all this stuff. And now that I'm 30, it's like I've dropped all of my fucks and I don't care because I'm 30 and I'm in it now, where it's like everything is different. It's like I can never go back. I'm never going to be in my 20s again. That part of my life is gone. It's over. And now I'm in my 30s.
I'm still in my 20s.
Yeah. And it's weird because it's like I'm in my 30s, but yeah, that's just going to be a perpetual life thing of like, I can never go back to what it was.
You can't go back, but you can go forward.
Exactly. And so now I'm like, hell yeah, I'm going to be the wildest, craziest 30-something ever.
Yeah, I didn't know I had insomnia until college because I had no idea how fast normal people could fall asleep. Yeah, I've dealt with insomnia too. There's a time when I was in high school, my mom probably remembers this, when I was like, I would essentially stay up all night, and then around 6 a.m. I'd go for a bike ride. I'd eat breakfast, then I'd go to sleep, and then I'd wake up right before dinner, eat dinner.
Wow.
I was essentially nocturnal.
That's how Jade was when we were younger. She was completely nocturnal too. Especially like in the summer, like in summer vacation.
Yeah, I'm 18 and it took me like a couple months ago to learn not everyone had 6-packs as kids. Yeah. Everyone has a 6-pack, right? You just don't see them all. There was that. Like I heard about that case of that kid that like had crazy hyperactive muscles.
Yeah, it was a muscle disorder, or it was like it affected his whole body, and he just grew muscles incredibly easily.
Yeah. But anyway, Jude, thanks for stopping by. New to the stream, sorry from the poor English, non-native speaker. Hey, no problem. Welcome in. I mean, your English is fine to me. So, take care. Stay safe. It's nice kind of talking about mental health anonymously. It's kind of freeing. I've dropped all my fucks.
Yes.
Looking forward to getting there. I'm about to be 25 and high-key dying. 25 is not dying. You still got 5 more years. Think about it this way: like
people in their 60s consider you a child.
Yeah, it's crazy how your perception of people younger than you changes.
I think that's why.
Because like when I was 18, I'm like, oh, I'm an adult now, like going to college, adulting.
And now you look at 18-year-olds and you're like, you fetus of a creature.
Well, maybe not fetus level, but like wow, like it's just crazy how much you change over the years and how you know, like I still see people who are probably like 60 as like old, maybe, but then I'm sure when I'm 60, I'm gonna be like, okay, 80 is old, and like people who are 30 are like babies, you know, like it's just gonna change.
It's like as you get older, it's like there's more and more people who would consider you old, and fewer and fewer people who would consider you young.
See, too, I'm not a fetus. Yeah, I think he's like around that age. Yeah. Yeah, we're trying to offend anyone with that. That's lame echo for that one.
Babies.
Yeah,
tiny babies.
You'll see what we mean when you get to 29, 30. You'll look at 18-year-olds and be like, okay,
that is a child.
Not a child, but
they're teenagers. They're children.
No, I wouldn't say children, because they can take offense to that.
Teenagers.
They're technically still teenagers, though. He says, I am a child. Yeah, that's true. It's a 6-year-old, a 30-year-old is less than half their age.
Yeah.
Basically, it said, don't worry, you have 5 years, so you're as old as Echo. It's true. I mean, I wouldn't say you're old. I wouldn't call 30 old.
I remember being 25 and thinking, oh, I'm so old. But it's like, no, because you're a quarter century. That's your quarter century year, where you're like, oh, I've covered 1/4 of 100 years, and you feel like so much time has passed, and it's a lot. But
they're experienced adults, or inexperienced adults.
Yes.
Yeah, it's like they're adult noobs.
Yes.
Right?
Yeah. Exactly.
Okay, so we talked about medication. So anti-anxiety stimulants. I'm not too familiar with those. I think those are mainly to treat ADHD, if I'm right.
Yeah, so like
Steve might
luckily,
know more about
probably
this.
my ADHD is mild enough that I'm not on like stimulant medication or like any of the ones that can be like kind of addictive or anything like that, like the Ritalins and what's the one that people take to study hard?
Oh.
It starts with an A.
Adderall. Adderall. Yes, that's it.
Yeah, so I'm not on any of those. I'm just on like a one that's supposed to like help with memory and stuff.
Mm-hmm. Yeah, Adderall. So
Yes.
Steve might know more about this, but I'm not too familiar with many stimulants because I don't have ADHD. Although I can experience symptoms similar to ADHD, with bipolar, because when you go into mania or hypomania, it's kind of like you can get distracted very easily, which is kind of like how ADHD is.
I think you texted me twice where like the project that you started with had changed. And it was like,
yeah,
you didn't even tell me what the first one was.
Yeah, I was kind of, so I've heard ADHD compared to, it's like having a Ferrari brain, but no GPS or navigation. So like it goes really fast, but you don't always get where you're going.
And that's like, that's where stimming comes from. Like when you like shake your leg or like doodle on papers, or where you have to like do kind of like two things at once to kind of keep that movement but be able to focus on something.
Yeah. Thanks, Didactic Lizard, for stopping by.
Thank you.
We're happy to do this now. It's definitely been really important to me to start doing mental health streams. I've been wanting to do it for a while. I just never like.
It's good for representation.
Yeah, and I was maybe a little like intimidated because it is like
it's a very personal part of your life.
It's personal, and it is like a sensitive topic. I wasn't sure that a lot of people would like want to do it. And it would just be me and like my dog and like one person like say, oh hey, what's up. But thank you all for being here. We couldn't do this kind of discussion without you, so I do really want to appreciate say how much we appreciate all you guys for being here. It really means a lot to us, especially as we're just getting started here with our
it's only our second one.
This is our second one. We did the first one,
and we do want to like pull
ago.
people on here too.
Yeah. So eventually, like we'll try to do like interviews or bring people on the show that maybe have like Steve with ADHD could talk about that.
That would be really good. Hello, Madam Asylum. Thank you for following.
And it's just right now, again, we're just starting out, so we don't really have the connections or the
well, we've got friends who also deal with like mental issues. Jade would be a good one to bring on to talk about ADHD and autism, because she has autism. She's also a woman, so it's like it presents very differently in women, and it's one of those things that like she'd be good to talk to. Hello, Neon Gen 1000.
Wow. I just want to see. Yeah. Well, Melsa, one of my favorite quotes is adulthood is like looking both ways before you cross the street and then getting hit by an airplane.
100%.
Yeah, a little bit.
For real.
Steve said stimulants work massively different with ADHD brains. Most of my fellow folk have to drink a cup or two of coffee to fall asleep.
That's actually so like this is a thing like Jade. This is the thing that Jade has talked about, because she has like much more severe ADHD. She's the one who was like, you should probably get tested for ADHD because I think you have it too. And part of that is because like what is it, self-medicating with caffeine is a thing that a lot of people with ADHD do. And it's like, yeah, I relate.
Sorry,
what you doing?
I wanted to link because someone was
my channel. If you just type Echo Gillette at the end of that. Just youtube.com/Echo Gillette.
Yeah, so here is Echo's
big link.
Work too. I got the big link. She's big on YouTube and the YouTube art community. Mostly, but
I mean, I have 500,000 subscribers, but that's like medium now.
And then here's mine. So Panthony asked, Are you guys streamers only, or do you do other stuff on the internet?
He mostly streams. He's starting to get into YouTube.
Yeah, I'm starting to get into you, whereas you're into YouTube and starting to get into streaming. So we're kind of helping each other out.
Yeah. Which is good, because I can't run streams for crap.
That's all good.
I need to get that, what is it, Nightbot or whatever? The one that like auto links things.
Yeah,
have you seen that? Just post things in the chat. Yeah.
We're getting things set up for her. But yeah,
my streams are very chaos.
I'm mostly a streamer, but I'm trying to get in. I mean, we both have like Twitter and Facebook and
always
and
on Twitter. You do Reddit stuff more than I do.
Yeah, I'm a little more on Reddit, but yeah, I mean, we just started doing these mental health talks, and we both play Minecraft a lot.
I love
other video games and
Minecraft
stuff.
Is good.
I play World of Warcraft a lot. And
34 I like pie says that. I love chaotic streams. Hell nice. Yeah.
We'll both get there. Yeah, we're getting. I mean, Echo will probably get there faster, but
I don't know about that.
I mean, you're already like got a presence on the internet.
But I still have to do the things and learn how to run all the software and get more organized at everything. We were in the wrong category last stream.
Well, we did a birthday stream over the weekend, and
it was
we were on creative when we were playing Jackbox.
I was drawing before that,
but it's okay. But yeah.
And we were 15 minutes late.
Oh, Jude asked what I'm drinking. This is beer, but it's ginger beer.
Is it just like
the Trader Joe's ginger beer?
Can I taste it?
Yeah.
I want to smell. I don't know if I like ginger beer.
Well, you're about to find out.
Oh, felt that in my nose. Oh, that was a lot.
That's a nope.
It's okay.
What are your guys'
I feel like that'd be good for your stomach.
What are your guys' thoughts on ginger beer? Yes? No? Run a poll? Yeah, I love ginger beer.
Ginger's a strong flavor.
I love ginger.
It's so good for you. Ginger's so good for you. Yeah.
And I just want to say real quick, the Trader Joe's ginger beer is really good because it doesn't have any pineapple juice in it.
Now that I've had
a lot of the other ginger
some
beers like Reed's and those ones have pineapple juice added to it. Which is still good. I mean, it's still good. I just like the more like neutral flavor, like instead of like a ginger pineapple mix.
I'll admit I've had worse. But I have had another ginger beer that was worse than that. That one was just stronger than I thought it was going to be and melted in my nose.
Yes.
The flavor's not too bad.
Yeah, thanks for helping Echo. Well, thanks for also helping as a moderator.
It's a mutually we're what's the thing where it's like symbiotic.
We're in a symbiotic relationship.
Yeah. Where it's like I can help him.
I may be a little more parasitic, but
I don't know about that.
But we're helping.
I can't
each other.
Although no,
I'm not really hurting you by doing it. It's more like there's one where one benefits and the other is like neutral. I forget what that one's called, but I'm trying to just grab some clout, you know.
I'm just grabbing your expertise, so it works.
All right, I have to go for now. All right, thanks for stopping by, Madam Islam. Thanks for the follow. Next time I go to Sri Lanka, I'll get you some of their ginger beer. It's
Ooh.
I would be totally down.
Ginger beer sounds
Jude's
great.
family is like from Sri Lanka. So.
Oh, cool.
And then Tony, is it Tony is my Portuguese name. Thanks for the hospitality. Hey, no problem. Welcome. We try to welcome everyone here. Thanks for being here. Thanks everybody. Let's go ahead and move on to our what else we're gonna talk about. So we're gonna talk about therapy next.
Yes, that was a big one.
As another treatment. So therapy, and I believe someone. I'm sorry if I missed it. I thought I saw someone earlier saying they were in NAZ and they were looking.
Yes, they were. I saw the one that you were talking about
for therapy. Oh, we got a poll. Do you like ginger beer? Nice.
Nice.
Thanks. I mean, that's probably Mel.
Thank you, Mel.
Yeah, sorry, I can't find your message, but I remember someone saying they're trying to find therapy in Arizona. So the first thing you got to do is call the place and see if they accept your insurance.
And if you don't have insurance,
and if they're taking new clients, because if they don't, do you want to say if you don't have insurance?
If you don't have insurance, it can be expensive. So like when I first got back to the U.S.
Even with insurance, it can be expensive.
Yeah. When I first got back to the U.S., it was like $200 a month just to see the therapist. That wasn't even counting like my or psychiatrist. That wasn't counting my like cost of medication. But it was like after, I have state insurance now, but when I first went, it was like $200 a month just to talk to her and to be prescribed my medication. And then if you do, I recommend asking.
Most people haven't tried it. Interesting. Give it a try. It's a very strong flavor.
Hello, Strawberry Giraffe. Oh, I like your username. Yes. So one of the things that I was actually able to do with talk therapy. So like, there's a difference between psychiatry and therapy. Talk therapy is like people who help you try to work things out internally, like in your own brain. They're like, oh, you need to like stop focusing so hard on this and try and like focus more on the present. Here's a mindfulness. Maybe here's like a meditation you could try, something like that.
Or cognitive behavioral therapy, ways to kind of change your behavior.
Versus psychiatry is like an actual doctor, is like a person who can help you with the medication aspect. Like I think most therapists, I could be wrong, but I think therapists can't really prescribe medication. Psychologists can.
Other way around. Psychologists are therapists, essentially. Psychiatrists are actually doctors.
Oh, psychiatry and psychology. That's what it is.
So a psychiatrist is a doctor who can prescribe medication. A psychologist is usually a therapist who can't prescribe medication but can do talk therapy.
Yeah. So it's like CBT. One is an actual like doctor that can prescribe medication, and the other one is more about like helping you work through things on like a more mental level.
So I'm just gonna kind of touch on CBT. There's a lot to it. For cognitive behavioral
wait, can I
therapy.
talk about the thing first? I want to finish this.
Go for it.
Because I was paying out of pocket, they were really nice about the talk therapy thing. So I talked with my psychiatrist, psychologist, whatever, and she was like, oh, there's a program because we're working with new students who are just getting into the field and have to do a certain amount of hours like in practice. So it was much cheaper and sometimes free compared to actual talk therapy with like fully experienced professionals. So you can sometimes go with like a slightly less experienced person for something more affordable, and then that's kind of like a good trade-off, and you can kind of like work together to both learn. But yeah, so that was the thing that I did for a while, was that I was working with a talk therapist who was just getting into her actual field after her education.
So there's, depending on what insurance you have, what country you live in, obviously this is going to be vastly different, but at least in Arizona, you can basically see if they have your insurance, or if you don't have insurance, do like what you recommended. And
also try, this is the thing with state insurance, at least in Arizona, if you can apply, if your income is below, I think it's either $12,000 or $20,000, I can't remember, for an individual, you can apply for state insurance and it will back pay up to 3 months. So if you apply, this was the thing where it was like when I was having my gallbladder surgery, I applied after a bunch of tests and stuff, and they back paid for all of the tests that I had taken before I applied, which was really cool. So state insurance is another thing that varies by state.
But yeah, once you've kind of found like a therapist that's taking new clients that can take your insurance, you just basically set an appointment, you go, and also like if you've been, like for me, I was hospitalized, and then they kind of set that up with my discharge plan, was to get me set up with a therapist. Like I had to do that like before I left the hospital. And yeah, just, you set it up, you usually go in for like either 40 minutes or an hour. And you kind of just like, it's just a lot of talking, like, talking about yourself, your problems, your illness, what your feelings are, what behavior you've been doing, and just trying to kind of help you like change your behavior or find the right resources or tools to kind of help you manage your illness or your depression or whatever you may need. There's also even there's couples counseling too. If you're in a relationship or if you're married, you can go to that, and it's kind of the same thing. It's just with couples, so it's different. Good. It's different from marriage counseling. I think that might be but it's similar.
I've heard this was just from like a couple I follow on YouTube, and they're a really great couple, and they go to talk therapy like every year, every like couple months or whatever, just to talk through things, just to help, like as like a relationship refresher, kind of, to just like help them get better at communicating with each other, to like have a third party there to help them work through any issues they could be having, or because relationships are work.
Yeah.
Boo, haha, you haha to all the people who are in relationships.
Haha, me.
You're married, loser. Sorry, Betsy. I think she's still watching.
No,
relationships are work.
We could probably do a whole episode on relationships.
I think you should at some point bring in Betsy to just talk about like what it's like to exist in relationship, or in relation to a person who has mental illness.
Yeah, that's definitely because even if you don't have a mental illness, if you're in a relationship with someone who does, you do have to help them manage that.
Yeah,
so
it's like it does affect other people's lives.
It's not just you; it does affect others. So CBT, I wanted to just kind of.
Bye, Shizu Rivera.
Hey, yeah, thanks for stopping by.
Have a good evening.
And yeah, bouncing experiences off an impartial third party is very important. So cognitive behavioral therapy, I'm not really going to read all of this, but just what it says here is that it's a form of psychological treatment that's been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders. That's something we haven't really talked about either.
Eating disorders?
And severe mental illness. Numerous.
Oh, I had an eating disorder.
Oh, well, there you go.
Yeah, I can talk about that.
Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, it's been demonstrated to be effective as, or more effective than, other forms of psychological therapy. So there are other methods too, but this is kind of like probably like the most popular, or like the main one that I've seen used, and that I've actually experienced as well.
Here, let me see this. You can answer chat things while I try and find a thing.
Oh, okay. Thanks for the stream. Okay, yeah, thanks for stopping by. Therapy can be a huge help just for basic maintenance and upkeep for general life. I think pretty much everybody should do at least a little talk therapy once in their life. Yeah.
Yeah, it can be helpful even if you don't have mental issues.
One thing I want to say
in terms
about
of self-awareness.
One thing I want to say about therapy, though, and this is mostly true for everyone, is that therapy will work if you think it's going to work, and if you're open to therapy. If you go into therapy with the mindset that this is not going to work and I'm wasting my time, then it's not going to work, and you will be wasting your time. So,
I mean, okay, I think there's a couple parts to it. One is like, yes, the positive attitude is a must, but also you have to mesh with your therapist. It is possible to have a therapist.
It's possible to go to a therapist. And
like I've one in particular who was just horrible, made so many things worse, was just absolutely awful.
So like therapy works. You just if you're open to it. If you
being open to it is incredibly important.
If you're closed to it and you think it's not going to work, it's probably not going to work. But yeah, like you were saying, you can if you go to a therapist and it's not working.
You can find another one.
You don't have to just give up and never try therapy again. You can try another therapist.
Yeah, it might not be the therapy. It could be the therapist.
Yes, a bad therapist can be awful.
Oh, it can mess you up. I've had
Jude lost feed. Yeah, we're having a little bit of connection issues. I'm not sure.
Are we? Oops.
Well, just throughout tonight, there's been a little bit of issues. We're trying to work that out. I'm not really sure what it is, but we haven't really been streaming much on this. Something. We might need to change our internet to Ethernet instead, but I don't want to drop the stream.
Yeah.
So
we can. Right,
well, I don't want to switch and then it disconnects. So but yeah, that's one of the reasons I'm afraid to go through it. You can always try therapy, and if it doesn't work, you just try another therapist. And
I've had 8. 2 of them have been really good or great. Most of them have been kind of medium, and then a solid handful were just awful.
Yeah, so it just depends on the person, depends who you get, really.
It can be hard to find someone that you really mesh with, because they have to be able to get inside your brain.
Yeah, it is messed up when you meet someone with bad therapist experience.
Oh, they can ruin therapy for you.
I've only had a couple therapists, and most of them have been like good. There's one that I really liked, and then there's one that was kind of like and then one that I was like So, and yeah, and then counseling is another form of therapy.
Yeah.
Grief counseling is something that's a thing. If you've lost someone, or if mostly if you like
It was
lost
actually
someone. Like for me, like I was just gonna say this real quick. A few years ago, you know, I lost one of my best friends to suicide, and so part of my therapy was at one point we were doing grief counseling for that. And that's another big reason why I want to kind of do this mental health thing is like, you know, I don't want to lose another friend, and you know, I want to kind of, you know, help other people and help my friends to you know, hopefully have that never happen again. So
yeah, the therapist that I had that was absolutely awful was a grief counselor, and it was like our
See,
mom
mine was still a therapist that just like threw it in there.
Ours was like, I guess you'd call them a grief counselor, but it was when it was a therapist that we had while our mother was going through hospice, because it's like hospice is the point where it's like we're just trying to comfort them until they pass because there's no helping anymore. And it was like my sister and I, we'd already grieved because we knew, like, this is a thing that, like, we'd been there throughout her entire decline and everything, and she kind of told us that we were grieving wrong, and it was just like it was really stupid. She was horrible. She made us like both break down, and it was awful. Yeah.
And so Jude, he's the brother of
Okay.
the James Fernandez, who took his life a few years ago. And I did want to
be awful. Yeah.
Yeah. I did want to mention Artemis. Welcome in, Michael. Thanks for being here. Has being able to talk about these things, kind of things in a somewhat public forum like Twitch helped you, or maybe helped you feel better for helping others?
I feel like a little bit of both.
A little bit of both.
It helps with, so like YouTube, I've made like maybe 2 videos just talking about like my mental health issues, and I think it helps because for one, I end up finding a lot of people who have like similar situations and who have the empathy and understand like in the comments. Which I really like. And then it also adds to the representation pool, because sometimes in media, when you have like people who do not have these issues writing characters that have these mental issues, they can be incredibly off or insulting or
exaggerated.
Yeah, exaggerated. Just something. It's better when you can see like real people who have these mental health issues who can be like, yeah, I have it. It's who I am. It's the same with like Lex Made You Look. She has diabetes, and she's like a young healthy person, but she's diabetic because
Is
like
it type
pancreas.
1?
I don't remember.
Okay.
But
Type 1's
she's
like the one that you're like kind of like born with almost, and then type 2
oh
is
yeah, like
obesity,
pancreatic failure. Mainly. Well, it's one is like a failure of your pancreas, and one is like a slow degrading of your pancreas, and one is like an immediate failure. Mm-hmm. And anyway, she's a person who like can be like, yeah, I'm a diabetic person, and these are the issues that I face, and it's like she's a completely normal person, but she can shine light on this issue that like not everyone realizes can affect anyone, and it's really cool.
Yeah, and then just for me to kind of touch on that, and I also wanted to address that's
related, especially with something like bipolar, because that's something that is very underrepresented.
Ducky Furball actually asked on Twitter, how has being on YouTube, Twitch affected your mental health, if at all? So that's another good question that's kind of related to this one. For me, so like I said, we're just starting out with this mental health thing, so we're kind of seeing how it goes. So far, it's been going well. You know, I like being able to talk to this with people, and you know, one of my big goals is just kind of break the stigma associated with suicide, with mental illnesses, especially, you know, bipolar, schizophrenia, autism, you know, and just be able to talk about these things in the open, because, you know, the less we talk about suicide and, you know, depression, you know, the more prevalent they're going to be internalized, and that's what we don't want. That's, you know, trying to, you know, prevent that kind of thing. So for me,
Oh, sorry.
it's okay.
Okay.
For me, like, when I first started streaming, I started on Twitch for like a little bit, but shortly after I switched to Mixer. I was on Mixer for a while, like maybe like half a year.
Mixer was pretty cool.
And then Mixer died, and I moved back to Twitch, and I was like trying to grow on Twitch like from nothing, and it was really tough. And like I don't think it helped my mental health much at all. Not only for me, but also with my wife. Like I was spending a lot of time streaming and not really spending a lot of time with her, which kind of strained our relationship a little bit. And then I would like stream, and there'd be like, two people, in there for like 5 hours, or 8 hours, or however long I was streaming. Like Mixer, I would actually get new people.
Oh, sorry.
But...
Ask as many questions as you want.
Yeah. You can ask us anything.
Manic9169.
Nice. But yeah, so like it was not helping my mental health. And like, man, am I like boring? Like, do people like not like me? And like I had this self-doubt and stuff. And I was like, all right, you know what? I'm just gonna be done with streaming. And I just stopped streaming for like 6 months because it just wasn't helping my mental health. And like I was like a little depressed. Maybe not entirely from the streaming, but maybe related to it. So I just like stopped streaming, and then like December I started again.
Have you considered streaming on YouTube?
Yeah, I just haven't done it.
You should try it.
Yeah, I'm open to try it. I've
heard some people say that it's gonna like pop off, that streaming on YouTube might actually be a good thing.
Yeah, just right now it's like I look and it's like World of Warcraft.
Especially now that they've just added what is it called? Clips.
Yeah, they did.
They added
clips,
like a
which could be monetized.
clip equivalent. There you go.
But what I was saying,
you were talking about streaming for your mental health.
Yes.
And how it relates.
So it can definitely affect you. I feel like it's hard to have streaming not affect you mentally.
Anything on the internet where you're,
especially like I feel like streaming is very personal. Yeah. Like it's yourself in your space, like broadcasting yourself to other people. Like videos, it can be like that too, like YouTube videos, but at least those you can edit and you can like crop and make yourself look good. Whereas streaming, like yeah, you got to make yourself look good live. Like, and that's a little more challenging, I think. But also video editing, like I suck at it.
When you're building stuff, dude, like when you get to the point where you have like analytics that you can see and you see your numbers like go, it's like when they're going up, it feels good, but it doesn't feel as bad as when they go down, which sucks.
All right, Jude. Sorry, I just want to say thanks for stopping by. We'll see you. Yeah, we're gonna try to do these every week. Last week, I just needed a break, so we didn't.
We were hanging out with Betsy and stuff.
Yeah, either every week or maybe every 2 weeks.
Yeah,
we're still figuring it out, but it seems like Wednesdays have been working for us. But yeah, thanks for stopping by, Jude. And yeah, if you have any questions, just let us know. I'm always here. You can text me, or you can shoot me a thing on Discord or whatever. Yeah. All right. So I think we've answered most.
Yeah, I think we're caught up on the chat as far as I know.
I like talk. So 34. I like pie. Nice. I hate talking about myself, but I like attention. I also hate the feeling of rejection when I start opening up and talk. I think that's talking about therapy again. Mm-hmm. Oh, this is awesome. Oh, thanks, Bob. Thanks for stopping by. We're not done yet, but we're
gonna be here for a while.
Thanks for being here. If you want to watch the rest, this will be saved as Twitch video.
It'll be saved on Twitch. Yeah.
On Echo's Twitch, so you can come back tomorrow.
I think they expire after like
2 weeks.
Is it 2 weeks?
I think it's 2 weeks.
Okay. And I'm gonna re-upload them to YouTube eventually.
Yeah, but they'll be on Twitch for a while. So then the next thing I wanted to talk about, and I could probably group this with alternatives, would be exercise as a treatment option for mental health,
and homeopathy, things like ashwagandha and St. John's wort.
We could probably group these into like alternatives. Maybe before we get to that, though, I want to talk about having a support network, because I think that's probably
very important.
One of the most important things you can have to treat mental health is having a support network, or finding one. That can have a huge impact on just like for me, it's just like knowing that like I'm not the only one, right? Like there's other people that have gone through similar experiences as me, and it helps you to connect with them and see like, okay, I'm not alone. There's other people that are dealing with the same struggles, the same issues that I'm dealing with, and it's okay, right? Like
Yeah.
it's not like I'm like you said before. It's not like I'm broken, but if I am, at least there's other people that are
Yeah,
like
there's
me,
people who can relate.
Um, so that's helped me, and then also just reaching out to family and to friends. You really got to be there for your friends. Like if you got a friend you haven't talked to in a while, like hit them up. Just say like, hey, how you doing?
Happy Valentine's Day.
Yeah, happy Valentine's Day.
Oh, I saw this really great thing that was like, it's okay to get flowers for your homies. These flowers are for my boys. And I was like, oh, I love it.
You can get some flowers for the
Send
bros,
some flowers
right?
to the bros.
Yeah. But yeah, just like check in with your friends every now and then, because like for me, like with James, like I had no idea what he was going through. I think a lot of us didn't have any idea, and it was kind of a sudden thing that like he killed himself. And like there was one of my friends who kind of knew a little bit about it, but
didn't think it was
for the
that
most part I was just
severe.
like what? And then like obviously like I had a little survivor's guilt, like oh, like I should have talked to him more, I should have been a better friend, and I start doing these should haves.
I did the same
which
thing.
you're not supposed to do.
Yeah, there was a person I went to high school with who was briefly a roommate. And it was just like a person who I kind of knew, but then I found out like 4 years later that they jumped off the tallest building at ASU, and I was like, oh wow, I had no idea that he was dealing with that much internally. And like I had a bunch of like, was I mean to him in high school? Did I make his life more miserable? Because I remember not liking him and just like not being mean to him, but like staying away from him and like just trying to like distance myself from him, because I was like, oh, he's really annoying and I don't want to be close friends with him. But like thinking back on it, I was like, is this like partially my fault? Did I do anything? And it's like, I hadn't talked to him in years. Like it just sucks.
And you can't blame yourself. Like that's what I learned to accept.
It's just a thing that sucks.
And I'm sorry if anyone out there has, lost someone to suicide. I know how hard it can be, but you do have to accept that, it was their decision. It wasn't anything that you did or you didn't do.
Yeah, or couldn't have done, or yeah.
It was ultimately there, unless you forced them to do it, which I really hope no one did that.
That's not even suicide. That's murder.
Yeah. Then you just gotta accept that like it was their decision. There was nothing I could have done differently. I could have, but that's not what happened, and you just gotta kind of accept that. Also, and once I did that, I kind of got a little bit more peace.
Yeah, I love whoever came up with the term survivor's guilt, because that's such a thing, and it's like having a term to put to it where it's like, holy crap, like I feel like shit, and it's like I didn't do anything that I know of. But yeah, you feel like crap. Yeah.
And it's tough, just
it's
like
not easy.
They're here 1 minute, the next they're gone, and then like that for me that was kind of like the first like real loss I've had. I mean, I had like lost my grandma, my other grandma before, but
never,
that was like
found family.
Yeah, that was like we kind of. I mean, they were old. Like it's not like
it was expected.
It was kind of we saw it coming, whereas this was just like out of the blue, and those are the worst when it's just like a sudden tragedy like that is what I would call it. It's a tragic death. And it's tough to cope with that sometimes, and that it kind of related to that was kind of like my feelings towards it sort of pushed me into my manic episode a little bit too.
That
because
makes sense.
When it happened, it was around the same time as
death, is it close to the anniversary?
Yeah, so
yeah, that makes sense. That's another thing that like. So, like, this is one of the things that my therapist actually explained to me, like, why suicide can be a side effect of SSRIs and medication. Because depression isn't just like what's happening in your brain. Like it isn't just your brain being sad. It's also like external factors interacting with the way that your brain is processing things around you. So if things are really bad around you and your brain is processing them poorly, it can make you want to die. And when sometimes when you end up on medication, on SSRIs, and they fix your motivations, where it's like you feel like you actually can do things now, and the situations around you haven't changed, you actually have the motivation to kill yourself. And that's like one of the reasons. So it was like it doesn't, that was the thing that my therapist had explained to me. It was like, it's not that it makes you want to kill yourself, it's that it gives you the motivation to do the thing that you already potentially wanted to do. And she was like, you have to be really like, if you still feel suicidal while you're on medication, you have to like let us know so that we can get you proper treatment. And it was like, luckily for me that wasn't the case, but yeah, that's a whole thing.
Yeah, Skull Gamer Force is it's kind of similar to ghosting. Had a horrible experience. My ex best friend thought there was something I did wrong, something I can do. Yeah, similar. I'd say a little worse, or a lot worse, because at least ghosting, it's just like
Technically
they're still around. I mean, it still
I mean,
sucks.
but you don't know it unless, I
Well,
mean, there's ways I guess you could just
yeah.
internet stalk them, but if they're not, then it's like that. Are they even okay?
Yeah,
feeling?
there is still that doubt and
But yeah, I'd
worry
say
that
similar.
like I did the wrong thing or I could have been a better person. So I do understand that aspect of it.
It's the aspect of suddenly losing connection with someone.
But that's why it's just really important to have a support network in place, or if you don't, just reach out. Like at least have like one or two people.
Like just a handful of people that if things get really, really bad, you can just reach out and say like, hey, I might die if you don't help me. Can you please help me? Because that's what I had to do.
Some people may.
That's what I had to do.
That.
I was flat out blunt because I was like, I need your help, and I was
not
like,
everyone's like that. A lot of times people will.
No, I think like in my message, I said I have to be blunt about this because it's one of those things where it's like, sometimes when you're in a mental state, you think that you're sending signals of like, I'm really depressed and I need help, and you think that you're sending these like really loud signals, but they're nothing. And it's like, and then everyone like, are people around you are like, I had no idea you were depressed, and it's like, did you not see me like not eating for 3 days or things like this? And you think you're sending these really loud signals, and at a point I was like, my sister is, no one's gonna hear me unless I say something. Like, unless I blankly say, I need your help. They're not going to know that I need their help. And so but that's what we were saying earlier, is like, I like blunt conversations, sometimes just being like, there's the thing.
Yeah.
There.
See, I'm not really like that. I'm kind of more like I'll try to like hint at it and like hope that they pick it up. I think a lot of people are like that too.
Everyone is like that,
like,
and that
like you want
it's
like
that
someone
can be
to help
good.
you, but you don't want to say that
you don't want
to
be overbearing.
And so I can be like that sometimes. Sometimes I can just like straight up say like, okay, I need some help. I'm going through some stuff. But not everyone can do that, and so it's hard. It's important to just know that everyone's different. Everyone has their own thing, and ultimately, one thing that I like to say is like, you are responsible for your own mental health. So
yeah, which is hard, and that's a hard thing to accept.
It is hard to accept that, but just know that like, unless like you're seriously disabled and you have a caretaker, like you're responsible for your own mental health. So it's important to reach out to get help, but you have to do that. You can't wait for people to come to you and say, hey, do you need help? Let me help you, because that might not happen. And if something happens to you,
sometimes being blunt can be
something that can happen.
Really good.
Yeah, I do agree. Being explicit is important, because other people can't read your mind. If you need help, you need to straight up ask, even when it's really hard. Yeah, definitely.
It's really nice when you can have people in your life who can like intuition their way through like the signals you're dropping down, but sometimes you just have to be painfully blunt, and it sucks. Like I went 25 years, quarter decade of just like suffering with depression before it got so bad that I was just very bluntly like, help.
Yeah.
And it sucks. It sucks so much.
But I think the most important thing is just ask for help.
Yeah, if you need help, ask for help.
Don't internalize forever. Like just ask for help, you know. And I think it's hard for people to do that sometimes because they're afraid that people like will judge them, or people will like not help them. Or
this is another thing. Callan says, I struggle with knowing if it's actually something big enough to be helped for. I know exactly what that feels like. That's one of the reasons that it's like I pushed off getting help and like getting therapy and medication and all this stuff for my mental illnesses until it was definitely life-threatening. And it's like, there was no point in suffering for as long as I did. I could have reached out like 10 years before, and that would have saved me years of my life. I could have had years of my life fully functional, and instead I was like, my problems aren't big enough for other people to help me. And it's like, what the heck?
Yeah. I like, so Alex said, communication is the hardest part of life. Everyone needs it. Everyone attempts it to some degree, but everyone needs to work really hard at it, and so often it's not enough.
Yeah.
That's true. That's very true.
It's like, it's stupid, but it's like getting ideas from one person's brain into another person's brain, and it's really stupid. It's like it's like throwing information to the cloud and getting it, download, and then, It's like, what was the thing?
Connection disabled.
Error.
Wi-Fi's gone. What do we do?
Oh, no.
Yeah. I always think of, if any of you guys here have seen Cool Hand Luke, what we have here is a failure to communicate.
Mm-hmm.
Definitely, I think that's a very important part of relationships is good communication.
Yes.
But just in general, too.
Like when you add
one rubber band at a time to a watermelon.
Have you ever seen those videos?
I've seen people do that.
Oh, it's crazy.
I've seen like streamers like do like a rubber band for every sub, like to a watermelon.
That's cool.
Yeah, I think it was T-Foy or whatever, that guy. So glad you guys are doing these streams. People really need stuff like this. Thanks so much for keep doing. Hey, thanks Starlight Rose. I'm glad to be doing these too. I'm glad that we're not the only ones benefiting. Like really, like why I want to do this is to benefit other people.
Dragons are great.
Dragons are great.
I love usenames that are sentences. Like
Beast
Echo
is
weird.
Back. What's up? Welcome in.
The Beast is back. Also a sentence.
The Beast is back. So we're talking here about mental health treatment. So we just covered therapy, and we were starting to go into the
Rose and Pearl.
Ooh. Oh, that's Meg.
Oh, hey, hello.
Thanks for the follow, Meg. And we're talking about alternatives. Well, we started to, and then we kind of
went back
about a lot of other stuff. Little Lantern Productions, hello, welcome in. So we're talking about alternatives. So like exercise. It's hard to exercise.
I hate that exercise actually works.
It does work.
And going to sleep on a reasonable hour.
Yeah, getting enough
not
sleep.
Being on your phone an hour before nighttime. Drinking a lot of water. Doing all the stupid responsible adult things. They actually help.
Yes.
And it sucks because it's such a stupid, straightforward thing.
Are y'all into helping with mental health? Yes. We're not like, just disclaimer.
We're just people who
we're not
who are
like
experienced.
therapists. We're not psychologists. We're not like licensed or anything. We've just experienced our own mental illnesses. I have bipolar disorder.
Depression and anxiety.
I've also experienced depression and anxiety as well. So, even if you think you might inconvenience someone's day, always say something to someone because they can help. That's true. Just check in with your friends, guys. Just if you got a friend you haven't talked to in like a long time, just say like, "Hey, what's up? How you doing?" You know, that's all you gotta do. Sometimes that's all it takes to
send them a postcard.
Get someone out of a postcard. People still use mail.
Yes, it's so much fun. My friends in the UK and I have been doing it. I've been just like sending out postcards to my friends. It's such a like fun little thing to get a postcard in the mail. Yeah.
And like people like just having there's actually been research. Hey, Lisa's back. Thanks for following. He's back, or she. But but like there's been research that like when you get like a text message or like a thing from your friend, you get like a hit of serotonin almost. And this is like true with like social media too, like getting likes, getting like comments and stuff like that. It's kind of like you get like a hit of serotonin, and that can help you like get out of depression, you know.
For what now?
like if you like reach out to a friend who's like
Yeah.
like mildly depressed or depressed, and like just like, and also just talking about it. Hey, thanks for the follow.
Wicked at Rest is following.
Just kind of like just being like just accountable with your friends, just checking in with them is really important for everyone involved. And that's kind of why I want to do this too, is like if I have friends that want to like come in and say, hey, like, hey, what's up, you know, how you doing, I can just be like, hey, how are you doing, man, how, you know, how's your day been going, that kind of thing. So that's kind of what this is for too, is just like check in, like, you know, if you want to talk about your day and say like, man, I had a shit day today, you can talk about that, you can talk about it in the chat if other people want to talk, you know. It's just creating a safe place where we can talk about this stuff. And then so we were talking about the alternatives, meditation and prayer.
See, that's one that I don't have. I'm not particularly religious.
One, and again, these. Well, actually, let's finish exercise first.
Okay, yeah.
Because we were talking about exercising. Like, there's been a lot of studies that, I mean, exercise really does help with depression. It's kind of a twofold thing, because when you exercise, you know, it does release serotonin, and, you know, you release that energy, which, you know, just makes you feel good. You also feel good because you're doing something good for yourself, right? And, you know, and if you're like, I'm overweight, you know, and
same.
I know a lot of my friends that like, you know, are overweight. Like, I think it's just Americans in general. And like, it helps your self-image if you work out and then you start, you know, losing weight, and it's kind of like a twofold, like I had this book that's called like The Upward Spiral, and a big thing of that was exercise, incorporating exercise into your life. Now, it is tough because obviously people are busy as hell these days, of, you know, putting exercise into your routine can be difficult. And also for people who don't like exercise, like me, and you probably don't like it either.
No, this is the thing that I want to talk about this. Hold on. Oh my gosh, that is
Thank you for the follow.
We tried. Thank you for following. This is the thing that I've this is the thing I've discovered about myself, and this is also something that I've realized. It came up in like my DNA test, that I have a genetic variant that is often found in Olympic power athletes, not and then there's another genetic variant that's found in like people who do like sprinting, running, more cardio-based things. So I am slightly better at building muscle than I am doing like cardio or like fast things. So I
hate running. I had asthma when I was younger.
Same.
I kind of use that as a crutch sometimes, but
yeah, it's like I've realized
I don't like running.
I can add weightlifting or things that are more like muscle building, kind of strenuous, perfectly fine. I can add those things to my routine. But if I try to add like run for 10 minutes, I won't do it. I just flat out will not, because I don't like doing cardio things. So I've realized that I can do more weightlifting type stuff.
How can I trick myself into exercising?
Beat Saber. Play Beat Saber. That's how I trick myself into exercising.
A way to exercise VR. That you have fun with.
The Wii?
Sports.
What's the wheel thing that just came out for the Switch?
I don't know.
The fun wheel thing, and
fun wheel
it's like
thing.
It's like you take the controllers and connect them to a wheel, and then you have to like dance or like move and stuff with it, and then it senses your movements, and it's kind of like the Wii Fit concept but extended to Switch, whatever that is. Video games. If you can find exercise video games, VR is the most fun.
I want to play Beat Saber too. It's so fun. I don't have a VR setup, but
so I bought a Quest, the Quest 2, And I was
Still have
like,
it?
I don't want to. Yes, but it's in Washington.
Oh, okay.
I left it in Washington because I was like, I'm going to be here in 3 months.
That's
I'm
true.
just going to leave this so it's not a problem. And I should have brought it because at the time I didn't know where I was going to be living. And I was like,
It's okay.
I don't want to have a bunch of stuff. But that's one of the things I left up north.
Another thing that helps me is, because I think it can be kind of intimidating to people who don't work out to just be like, oh, now I got to work out like every day. And so you just like don't do it. It's like, just do like one thing that's like small and then just kind of like build up to it. Like we've been like going on walks around the canal. I mean, I didn't today
Ring Fit
because I was
Adventure.
super busy, but Ring Fit Adventure, that was it.
Oh yeah, that's another one, walking around the canal.
Just going on a walk. I mean, it's a great way to, just, I mean, unless you live in like a really shady neighborhood. But
the dogs are good motivators.
Yeah, if you have dogs, walk them.
My dog is very high energy, and so I need to take him out outside very often.
Yeah. I stopped trying to force myself into doing cardio and started doing lifting, and it changed my life. I hate cardio, but I love lifting. It's starting very simple, and now I power lift. See, there you go.
See, like
it kind of, like I said, the upward spiral. So you just start doing one thing, like, okay, I'm gonna do a lap around the neighborhood, and then the next week, okay, I'll do 2 laps. I'll do it on 2 days this time, and you just kind of work up to it so that it becomes like part of your routine. So that then you're like, okay, I want to, you just become second nature. Like, okay, I'm gonna go on a walk now, or I'm gonna, go to the gym and lift weights. And everyone's different, obviously. Some people love running. They get like, the runner's high and like really enjoy it.
Not me.
I don't. Like, I've done 5Ks and stuff, but I'm not like. That's about.
I feel like I barely made the mile.
My fitness.
Was it like we had to?
Oh, running the mile.
4-minute mile, is that what it is?
In high school, it wasn't 4 minutes.
What was the time?
That's like super ass fast.
What was the?
It was like I don't know. For me, I would usually be around like 8 minutes.
Was it the 8-minute mile? 10-minute mile? I don't remember. But we had to like get. There was a point where it was like we did running in PE where it was like you had to, by the end of the year, you had to be able to run a mile under a certain amount of time to pass. Yeah,
oh,
and it was like a pass or fail grade.
That's terrible.
Yeah, it wasn't like
we just had to do.
It wasn't an unrealistic amount of time though, so it was like you could do it reasonably as long as you were like in shape enough for like a teenager.
Yeah, we just had to do every.
It wasn't that
every
bad.
Other Thursday we had to run a mile. I hated it,
but yeah. I changed my PE class. I love revolutionizing things. I actually changed my PE class, and if any of you hate PE, this is a thing that you can propose. Oh wait, we're in the middle of a pandemic, so most of you have online schooling. Never mind. But when I was in high school, we would always do the thing where it's like we do exercises in the beginning and then we'd play a sport. And me and all the nerdy kids would like stand off to the side because the kids were so damn competitive they would ruin it and make it miserable. And so we'd just stay out of the way. We'd always be picked last and just want to stay out of the way. So eventually I went up to my gym teacher and I was like, hey, I'm not exercising or doing anything this whole time because they're too serious about this and I don't give a crap. Can I just walk around the gym for PE? Because at least that way I'll get some exercise. Like just walk. And he was like, okay, yeah, that works for me. That's fine. And so I started doing that. And then the other like nerdy kids were like, that's a good idea. Can we walk too because we hate this and we're not getting exercise? And he was like, sure. So there ended up being like 10 kids out of the like 40, I guess. Not even 40, like 30, who just spend the whole time walking around.
See, I did that in 8th grade, but then I got detention for it because we were supposed to be
walking?
Running and we were just walking.
Yeah, see, but like ours was,
anyway,
we had to.
Back in Georgia.
In the beginning, we had to run around the thing, but after a certain amount of time, or after our beginning things, it was just like, play the sport now.
Hey, Harry, welcome in.
Hello.
He's the guy I was telling you about the sushi in Rome
thing.
4 minutes, are you trying to kill me, Echo? Yeah, that's super.
See, I don't exercise. This is not even
like
a thing.
Olympic
I haven't run
speed.
a mile in like 10 years.
Yeah. I think my fastest ever is
and
like
I hopefully
10
will
miles.
never have to again.
In high school, I
hated wait. It depends on how old you are. It depends on a lot of factors. So
should I come out to my parents?
To my parents is gay. It depends on, honestly, it kind of depends on your parents and like your situation and your safety. So be safe. Yeah. But as long as like if you think everything will be okay, I say go for it.
Yeah.
And I wish you nothing but luck and love in life.
Yeah, it depends on your safety for
Yeah,
sure.
as long
Like,
as you're safe.
if they're gonna like disown you,
Yeah, if they're
and
if
you're
they're
living
like
with them,
super awful, like conservative, no offense, but if they're super like anti, like if they're super homophobic, maybe hold off until you're in like a place where you can have a safe place to stay. But if you're not at risk of like being kicked out or anything like that, best of luck to you. I wish you nothing but
my PE in high school gave us the option. Also, I live in Georgia. Well, oh, nice.
Hey.
I used to live in so Camden County, in St. Mary's. It's like 6 miles north of the Florida border.
Harris says I wasn't comfortable coming out.
Until I wasn't very dependent on my parents. Yeah, so
it depends on your dependability, or like for your.
It's kind of a tough question to.
It's a very
ask,
difficult
like,
question in
general.
terms of your safety.
Because it's also like
So
safety, and it's a personal thing. Right?
Yeah, it's a very personal.
It's your decision to do that or not. So you really got to think about it for yourself, and we can offer advice, but ultimately it's going to come down to.
I mean, bottom line, make the decision on your safety. My next default is yes, go for it. Live your life.
Yeah. I waited until I moved out to come out. Yeah.
Understandable.
So, I feel like a lot of people will do that. Like they wait till they're out of the house, and then they get their independence and kind of really cement their, who they are as a person, and that kind of helps them to their self-discovery. Like Dave and Mink's song Spectrum. Not sure what that is.
I don't know that.
I was lucky to have parents super cool about it. That's good.
Nice.
Yeah. I'm quite proud that when my son came out to me as bi, I could look directly at him and inform him that he still had to do the dishes.
I like that.
Yeah, that's good. That's a very like.
That's a solid that's a solid response.
It's a solid dad thing. Like
you still have to
okay,
do the dishes.
but you still got to do the dishes. I will tomorrow at 2:30 p.m. a.m. Can you stream? I'm gonna be at work. Well, it depends. 2:30 p.m. What time zone?
Yeah.
I know where Camden is. I live close to Atlanta. Okay, I've been to Atlanta. We went to Stone Mountain out there. That was pretty cool. I don't know. It's like giant like carvings in a mountain, but it is like I think it's like isn't it like Confederate guys though? So now that I think back, it's like I think like Robert E. Lee is there, but I think there's also like.
Is it a Confederate statue?
No, it's a mountain that they like carved, kind of like Mount Rushmore, but like
I was gonna say,
smaller.
are you talking about Mount Rushmore?
No. It was, but I was a kid back then. I'm just like, oh, cool, look, there's people in the mountain. But now I'm like wondering, like, wonder if people still go there. Anyway, in the meantime, I found peace knowing my sexuality is for myself, and that I accepted myself and had love and friends.
That's another thing. It can be hard to like come out to yourself.
That's true. Told my parents that I was gay when they were drunk because then I could bring girlfriends home, and I'd say, "I told you already. I'm not."
I weirdly like that's I don't know how creative a strategy that is, but I like it.
Yeah. Okay. Stone Mountain's the largest Confederate monument in the United States.
Oh God.
Yeah.
Okay.
Well, I was like 12 when we saw it, and I thought it was cool. But now I'm looking back, like, well, I didn't know that it was like
the history of it and all the things that are around it.
I do remember we did a duck tour where we went on this like aquatic vehicle that like went into a lake, and we had these little duck calls. Anyway.
Oh, that sounds like fun.
Yeah. I'm going to come out at 2:30 p.m. Colorado. Okay.
Colorado is what? Central?
We're on Colorado time. Colorado's mountain time.
Are we on Colorado time?
Right now, yeah. Because we don't do daylight savings in Arizona, so it's 9:22 p.m. where you live at, right?
Are we on Washington? Yeah. What time? Just tell us what time it is right now, and
I'm pretty sure it's the same time. So 2:30. I'm gonna be at work. And
I might be streaming. It's hard to tell. It depends on what time I wake up and if my freaking my iPad charges this time so that I can actually jump on and draw some emotes. Because that's what I want to do tomorrow.
Yeah, carving is controversial, but it does exist and people still hike it. So we pretty much covered exercise. It's good for you. Another thing is meditation or prayer. If you're religious or not. Meditation can help, in prayer, it's like a type of meditation almost. Like to just kind of like And mindfulness is another thing that you hear people talking about more these days. It doesn't work for everyone. Like for me, I don't really meditate that much, but it can help just like kind of like quieting your mind and just like, you know, I think it helps a lot with anxiety sometimes, and just like not thinking about the future, but just think of like right now. And there's like exercises online you guys can do, like people that's like, okay, like close your eyes, you know, think of like a
I
stream or
saw a
like a
really
meadow.
great
And
meme the other day that
it
was
can
like,
help.
oh yeah, you have anxiety? Name 5 things you can see. And it's like, that's one of the strategies
Yes,
for...
I remember that now. That's called a grounding exercise.
Yeah.
What
But
you
it's like a
do.
play on the, oh, you're a fan of this band? Name 5 of their songs.
Oh, I see.
And it's like, it's great. I love it.
But yeah, but that actually is a thing. It's
Yeah.
a grounding exercise where like if you have really bad anxiety, or like you're thinking
Where
of
it's
like
like
a
you name
panic
5
attack.
things you can see, and then
Hey,
4 things.
thanks for the follow. The one and only
you
Phineas.
can-
Phineas and Ferb fan?
Oh.
Potentially?
No,
Howdy. Welcome in. We're
it's
talking
3
about
things you can hear,
mental health treatment.
2 things you could taste, and 1 thing you could smell or something. It's something like that. But it's like a system where it's like you go through your senses. And...
Yeah, for this one it's like you just start like saying things in a room, like, okay, there's a stone floor.
They're actually named Phineas.
Oh, nice.
Nice.
Welcome Local League. Or like there's a guitar over there, there's a poster here, there's a plant up there, and it can kind of like help kind of just like slow down you mentally, and just kind of like bring you back to reality, you know, if you feel yourself kind of going off the rails. So that's another like kind of that's an aspect of CBT, an element to it. So that's like mindfulness, meditation, prayer. Did you want to read this?
I've read the paragraph. I was gonna ask how old they were, because there's a lot of factors. They were just saying that they went through a depression in 3rd grade and had some mental issues. It's a lot that happened.
Okay,
but
let me touch on this, because I think I can help.
Thank you.
Hey, thanks for the cheer.
Yes.
I want to say I loved your role on BoJack Horseman as
Thank
an ace
you.
person myself, seeing the further rep from the show, and your
It's such
connecting
good
with the big
representation.
feels.
Like, it made me
Nice.
cry at the end of like every season, because I was like, this is what it feels like.
She was on BoJack Horseman, guys.
Yes.
She was a bunny. But let me get back to this question, and then we
14 in 8th grade. So this is one of those things where it's like, when you're very young, your life is controlled by a lot of other people, which sucks. And
so I had experienced suicidal thoughts in like high school.
I did too. This
maybe
is one of
not
those
middle
things
school,
where it's like I did since I was like a really little kid, and part of that is because I had like a mental issue. Like I need SSRIs, like I need serotonin reuptake inhibitors, whatever, because otherwise like my brain doesn't function like a normal brain.
Here's the thing that I want to talk about with suicide in particular. If you go to a doctor or a therapist and you say, I'm having suicidal thoughts, by law they have to like sort of detain you until because if you are they'll
ask you if you're having suicidal thoughts, but then they ask you if you're making plans. That's the second question.
But for me, they didn't even ask that second part.
Really? They always ask that for me.
But anyway,
I feel like we've had like slightly different experiences where it's like
probably.
I've begged people like, can you please take me to the hospital? And they're like,
your therapist will like work you through it. So if that does happen again, I was severely bullied and always got into fight. Yeah, I was bullied a little
a social
bit
reject
as well. I would say
also
if you have a
get older, it gets better.
Yeah, if you do have a good relationship with your parents, they can be a good resource to talk about those things. It just depends on the kind of relationship you have with them. Or you said you have your now girlfriend.
The thing is, if you have a good adult in your life, because it's like when I was a kid,
it doesn't always have to be your parents. If you have like an uncle or like
if you have a responsible or an adult who actually like respects you as a human being, because like when I was when I was really little kid, one of the best, we're dropping frame rates. When I was a little kid, my mom was like a drunk and my dad was gone. And so it's like the household adults that I had weren't super great. But my psychiatrist, or not psychiatrist, my therapist at the time was like one of the two good ones that I'd had. And she was really great and like a person I could actually talk to. But I was really young, so I didn't know that I needed like medication help and stuff like that. But yeah, Team Awkward Raisins Forever. Yes, thank you.
Yes,
Maltron.
and BoJack Horseman's actually a really good show for representation of mental illnesses.
Yes, it is,
especially depression. Yeah, it's
I don't
want to.
I don't know if I want to give spoilers or. It's like,
nah, don't give spoilers.
Watch BoJack Horseman because like the representation of depression and anxiety is fantastic. The arcs that they go through with their characters are very real. They're very like, you can tell they actually talked with people who have these mental problems and reflected their experiences in the show, which is really good.
Yeah. So you say you have a good relationship with your mom. So, I mean, if you feel comfortable opening up to her about that, if it were to happen, that would probably be my advice to you.
I feel like even before it happens, like you should just talk to her and be like, I experienced this before, and I feel like I should let you know.
Talking about your
it's one of those things where it's like
mood,
being blunt can make a huge difference. And just be like, calmly be like, this is a thing that I experienced in the past, and I'm not going through it now, but I don't know if it's never going to happen again or if it's going to happen again. It's one of those things where it's like, if you have an adult who will listen to you as a human being, talk to them about your experiences because they can help you get through it. And hopefully you can save many of the years that I lost to depression.
Know some of the details, but I don't want to worry her.
I think she would be more worried.
She'd be more worried if you were suicidal, I think. So,
trust me. Like, it's one of those things that's like,
parent, but
you could be very easily if you wanted to.
Yeah.
But it's like, it's one of those things where it's like, she would probably rather know than not know.
Yeah. Then, you know what was not great growing up was being called Shamu, because I am and still are overweight. Nowadays, it doesn't bother me. That sucks. That's mean. Yeah, I mean, I
feel like people are getting better about body positivity and just realizing, like, if every person ate the exact same diet, we would still all be different sizes and shapes.
Mm-hmm.
Because
but
we
at the
all
same time, like, people still bully. Like, it's
there's
still
assholes for sure. In school, I saw the greatest thing, and I'm taking it to heart, and I'm like fully exercising this. 2021 is the year that we stop 2021 is the year that we completely drop self-deprecation and instead replace it with delusional sexiness. So we're all delusionally sexy now.
Yeah,
so it's like,
sexy.
I'm so sexy, you don't even know. And it's like,
hello, Pam Conpalta.
Hello.
Welcome in.
Just believe in your sexiness to a delusional degree. Believe in your attractiveness. It actually makes you feel better. Like if you just like try to be delusional about
it's like positive self-talk.
It's like smiling actually makes you, like, if you fake smile, it will make you happier. Have you seen that?
Yeah, although sometimes I've tried it and it doesn't work.
It doesn't always. I think it's one of those like
remember in Kim's Convenience, I don't know if you guys ever watched that show, but like remember the part where he's like the happy face, like he's like posing for a picture,
take the picture
constantly. He's like, happy appa. Anyway,
this is my successful face.
Children are vicious little monsters.
Yeah, they
I teach a classroom full of them, and I can confirm, yes.
Are they? Okay, here's the thing. If you teach a class of them, that means you've experienced childhood and are now, exposed to current childhood. Are they getting better? Because I feel like a lot of them are getting better. Does that make sense?
Or are they getting worse?
I would hope
can you
they're
tell?
Getting better.
Because now you're an observer, you're not an actual participant.
Yeah, can you tell?
It's a little different.
Does it feel like they're getting better?
But anyway, we're almost done with like the main things we wanted to cover, and then I have another question I was going to ask. I was gonna ask, and then if anyone in the chat wants to ask questions, we'll kind of just have a
They're
free
better
for
in
all.
some ways and worse than others. That makes sense.
Yeah, they're probably like, I feel like they're getting smarter with like the technology and stuff. Like you see like 5-year-olds with like iPads, and it's like,
oh my gosh, my friend and I were talking about this, like in terms of art. Like there's so many art things online where you can just Google like how to draw this, and it'll pop up with like a million things that you can learn. Whereas when we were kids, we had no idea what the heck we were doing.
Yep.
Same thing with makeup. Middle schoolers in like 2000 looked stupid because none of us had any idea what we were doing. You just like bought makeup and prayed. And then yeah, like now it's like you have kids with cat eyes, and it's like how why is your smoky eyeshadow on fleek?
I got my first phone in ninth grade. Yeah, I got my first cell phone in 8th grade, and it was like the old school flip phone. Like, I think it had one. Did it have a game on it? I don't remember. I don't think it did. It had the little antenna that you could pull up.
Mine had like Centipede, that thing that you could.
Know what? I think I still have it.
I still have mine too.
I'll get it later. Let's finish our talk first, and if we have time, I'll show you guys my collection. Social media is what goes behind the scenes is vicious. Yeah, for sure. I can't imagine like having Facebook in like first grade. Like people do that.
Also having like, I'm so happy that I grew up with the internet so that like all of my 13-year-old mishaps are not online.
They're not publicized for the world.
Because you go through so much development.
Yeah, and I had a bad experience with social media in high school. I had posted something about a song I was hearing by Rob Zombie, and my ex thought it meant I wanted to kill her, and she like called the school, or I don't know, maybe her mom did or something, and she had like an uncle that was a police officer or something, and they literally like pulled me out of class and like brought me down to like the
This sounds like she was having some kind of like
I don't know what was going on, but they brought me down to like the school counselor or whatever, and they are like, oh, are you doing okay? Like, what's going on with you? Like, we saw this thing on Facebook, and you know, blah blah blah. And I was like, oh yeah, that was the song I was listening to. And they're like, oh, so you don't want to like hurt, you know, this person or and I'm like no, I was just listening, had nothing to do with her at all, honestly. It was a song I was listening to. I posted some of the lyrics to it because I thought they were cool. And I was just like, dang. And then like later, like my parents maybe like unfriend her on Facebook and like delete everything. And yeah, that was a bad experience. So I'm sure people still, you know, get stuff like that these days.
Mel says, what do you call when you use a hobby as therapy? Coping. I would say it's a coping mechanism.
Yeah,
I feel like that.
And just it just gives you a distraction. The best thing you can do if you have
hobbies are great.
If you have depression, is like just keep yourself occupied, like do something. So like hobbies give you a chance to do something and kind of distract yourself from like your depression. So it can really help like improve your mood. Was a strong Dragula? No, it was Living Dead Girl.
Oh.
So that could be why
I can understand
why they misinterpreted. But that was the song. And then okay, I'm currently building a gaming PC to take mind of my mental health. Nice. I built my PC 5 years ago and then upgraded it last year, so I'm really savvy with PC components and stuff. If you can find the parts
That's another
for
thing. I need to have you help me build a new PC.
A lot of them are like a stock. But I wanted to finish this first before we kind of like go off on tangents.
Yeah.
The last thing, so we went through alternatives like meditation, mindfulness, exercise, how those can be good things to do for mental health treatment. The last thing I want to cover is bad treatment. So things you shouldn't do. So, for example, self-medicating with alcohol or with other drugs,
or with caffeine. That's
caffeine, yeah, or weed. I mean,
it's like
you can enjoy those things at a level, but it can get to a point where you're dependent on it, or like, if you're an alcoholic, I'm sure the dangers of drinking too much and how it can impact yourself and your family and relationships. Um, so that's something that people can do. And I also think back to like back in the day. So the good thing about the time we live in is there's been a lot of research into mental illnesses and treatment options from say like 50 years ago or
Yeah.
100 years ago. I mean, even just like 30
I mean,
years
there
ago.
there could totally be more, but yes,
So
we're
like
so
like
much
for
better
example,
off.
like my grandpa I think was an alcoholic or like drank a lot, and I wonder like maybe he had some kind of mental
It's like
illness
my
that
mom for
back then it
sure.
just wasn't a thing, and then like
My
yeah,
mom
your
for
mom.
sure did. Like I've talked with my other family members about this. Like she had mental issues. Like I know for certain she probably had depression, and that's probably where I get it from. And so she it's like when I started having early symptoms of depression, she took me to a church to get an exorcism because she was worried that I was possessed by demons or something. And it's like that's not the right response to have to your like child going through like crazy psychotic episodes. And it's she should have been on medication. Like she really should have gotten help for her mental issues, but I don't think that she knew because she didn't have this. She didn't have people talking about it. She didn't have like representation of people saying like, "Hey, you might be going through this because your brain is wired wrong or wired differently." And so if you like talk to a psychiatrist or a doctor, they can help you get on track and fix this. And so like I know that had to have been a huge part of like why she had died, cuz like she essentially like gave up and became an alcoholic, and that was like her very slow and painful way of killing herself. And it's like she like just talking to my family and like them telling me some of the stories about what she was like before I was even born. She had so many mental issues. Like she really should have gotten diagnosed. But I don't think that anyone even thought about it. I don't think anyone even thought to mention it.
Yeah.
Because it's one of those things
And
where
it's
it's
like,
like,
and if like people are older, if you have
yeah,
like older people that were in a different generation that still might not think like depression is a thing, like it's like, well, I was
you're
in the
just a
Great
little
Depression. I
sad.
know what depression
Oh, hello,
is.
Sea Witch. Oh, I like your username.
Oh, nice.
But yeah,
Like they might just be kind of in that antiquated mindset where
yeah, that old-fashioned
they're not thinking about it.
depression is just being a little sad, isn't it? Just perk
Yeah,
yourself
just
up.
be happy. It's so
It's a
easy.
choice.
But yeah. So self-medicating is what.
Yeah,
that's
self-medicating
usually
doesn't
called.
usually work.
Another thing I wanted to talk about. I should have mentioned this when we were talking about medication.
Ketro.
My grandma denies depression exists. Yeah, there's people like that.
Yeah, and I feel like part of that is because they don't have this. They don't have like
it's not how they
representation
grew up.
of
They
real
just,
people. Yeah.
A lot of people, especially old people, like they are in a certain mindset that's worked for them their whole life, and they're not going to change. And they're not.
Yeah.
A lot of them. I mean, not everyone, obviously, but there are a lot of people that are like closed-minded, that are kind of like reserved and can be cynical sometimes. But yeah, it's a thing. So happy you're still alive. Well, thanks.
Yeah.
I don't know if you're talking to Echo or me or both, but thank you.
Well, I think it's just because we're still here.
Oh, still alive. I was
alive.
Okay, we're talking about like suicide.
Mental. Yes.
I thought you meant like so happy you're still alive.
I realized.
It's
yeah.
still alive. Like we're still streaming. Okay.
Yeah.
Gotcha. But yeah, we're good here.
Yeah.
So
yeah, don't self-medicate.
Yeah, self-medicating. So I wanted to look at. I would drink like 8 cups of coffee a day before I got diagnosed with depression and got meds. One thing I was going to talk about, I literally was just going to say it, was about medication. A lot of times people will start on medication and start feeling better and then think, oh, I feel better. I don't need to take this medication anymore.
Yeah, that's bad.
And stop. So that's like, it's kind of like a self-medication where you just stop taking medication. Don't my mom, what do you say? Old people? You're not that old, Mom. But yeah, just stopping medication.
Yeah, that's not great.
It's not like if you are gonna if it's really not working for you, and
You should
you
be
have to
working
talk
with
to
a
your
professional,
psychiatrist because there are withdrawals to some of these medications
Yeah,
that
there
can
was.
lead you to have things like
Mhm.
become suicidal or um,
That
just
that
hurt
has
you
happened to
mentally.
me where it's like I tapered off my medication because I had a friend who was also taking like a similar medication. That wasn't escitalopram, it was citalopram, which is like it's like a variant of roughly the same chemical. Anyway, she was taking it for anxiety. She tapered off of it and she was like, I'm actually doing okay. And she managed to be like pretty fine. I don't think she takes her medication, like that specific medication anymore. And I was like, oh, maybe that would work for me. No. Like I tapered off of it and within like a week or two I was like, "Oh no. This is not
Not
no.
good.
This is not good.
Yeah.
I feel like garbage." My mental health was like immediately like I could feel the difference between like being on and off my medication where it was like I could fall into a ditch so easily.
Yeah, and part of it too is as you take medication for extended periods of time, your body becomes used to it, and taking that out, it would be like, like say
It's
you,
like pulling a plug almost.
yeah, it's kind of like say you need to like take a vitamin C pill every day, and then you just don't. Like your body's deficient, and then that can cause all kinds of problems.
Yeah.
So you never want, and especially like I've even like I'm guilty of this sometimes too, is where I'm like, man, I'm feeling so good, I probably don't need this meds, but it's like those meds are helping you feel that way. So
yeah. I feel like everyone who's been on medication has had one instance of like, I feel fine, I don't need this, and then they realize.
Yeah. For me, like I've never just like quit cold turkey, but there was one night where like I think I had like maybe drank a little bit too much, and then like I woke up in the middle of the night, or actually it was in the morning, it was like 5 a.m. and like I had like massive anxiety, and I was like, oh no, I forgot to take my stuff, and then I took it, and then I was able to get back to sleep, and then when I woke up, like I was fine.
Yeah. I've been in that instance before where it's like I'll forget to take my meds for a day, and then the next day it's like I can slowly start to tell, and it's like, oh, I forgot to take my meds yesterday, and I'm starting to feel it, and yeah, that always sucks.
Yeah, remember to take your meds.
Yeah, remember to take your meds. It's very important. Yes.
Has all the days.
Oh, I felt so old when I had to buy one.
I know.
Because I was like, this is old. This is something that an 80-year-old lady would.
This is what my grandma does.
This is what my grandma does. This
Yeah.
isn't a me thing. And now I'm just like, everyone has this.
Even like my parents.
I should get a bedazzled one.
All kinds of.
I should get like a fun one.
Yeah, you should make one. You can make a video. I made my own pill box.
Oh, I like that. Maybe I'll like deck out my pill box.
And then you give me 20% of the ad revenue.
And then we can talk about mental health issues. Exactly. That'll be fun. I might paint my med box now.
So yeah, don't do that. Make sure you tell your
Remember
doctors
to take your meds.
Yes, Mel. Make sure if you're on any meds already, tell your doctor which meds you're on, because they can affect each other.
Yeah, they can.
For sure. It sounds amazing. I want to watch that. There you go.
Oh yeah.
Video idea.
I actually really like that idea. I might actually do it because my pill box is so old, and it's like from the dollar store. It's the only one I've ever had, and so that means it's, oh god, almost 4 years old, 5 years old. All of the things have rubbed off completely.
One of my little doors broke on
Monday, Tuesday,
Thursday
whatever.
night is a fun one because the little doors broke.
Yeah, mine is like completely broken where all of the labels have just they're so old that they're just gone. But I just know what I'm doing now.
Yeah, that is a great analogy. If you have bacterial infection, always take antibiotics. It's full course. You stop, worse things can still happen.
Yes.
Exactly. Same thing with they're both medications. It's the same thing.
Yep, and doctors know. This is an annoying thing. Doctors know what they're talking about. Most of them, like generally, the doctor consensus is usually like, "Oh, hi, my dog." Usually, when there's a consensus among doctors, it's pretty true, because these people have literally studied the human body and medicine and all of these interactions or whatever their specialty is for 8 to 12 years.
Yeah. They know what
they've dedicated their lives to this.
Don't
Trust
look on
them.
WebMD for
or
10
like
minutes
trust your random aunt on
you...
Facebook who's like, I heard that amethyst is great for healing headaches. It's like,
yeah.
Okay.
I remember. Oh, hi Betsy. I remember you're
Hello.
so resistant to getting that pill box. Also, you didn't like the idea of having to take medication for the rest of your life. That's true.
Yeah.
I
See,
didn't want to get the pill box because I wanted to oh, I'll remember to take it, and I did for a long time. But
it helps
then
so
now
much.
I'm on, well, back then too I was only on one medication. I took one pill at night, so it wasn't that hard. Now I take one in the morning and two at night, so it's a little more to track.
See, I take like
But I do like using it now, and yeah, I didn't like having to take medication for the rest of my life because I felt like, oh man, what if there's a zombie apocalypse?
that was my thought too. I'm just like, well, what happens if I can't access this medication? If I end up
like,
not being able to have insurance or something, or I can't afford it, then what I'm gonna do?
which is a totally unrealistic thing for me to think about, by the
Yeah.
way. But you know,
It's always in the back of your mind because it's
if
like
it's
this
a
is like a
nuclear
synthetic
holocaust,
thing. I
like-
can't. What am I gonna do?
yeah.
And it's a anyway. So like with my pill box, I have like melatonin and ashwagandha root and like all these other random things that have been recommended to me by Crystal, who's like a magical human being. Thank you for being my homeopathy therapist person. Crystal's, I don't know. She's really cool, but she knows all of the like crazy vitamins and stuff. So I always reach out to her and I'm like, tell me about different plants and roots that are good for this. And she'll have like a whole 3-page essay. Yes, Crystal Joy. She's really good at knowing about like vitamins and stuff.
Nice.
And so I always defer to her when it comes to that kind of thing. But yes, there's like, so I have a handful of pills that I take, including my like allergy meds. I don't know if you saw when I started this, but it's like I had like scratched my skin like that, and I had like all these red marks, and that's like this weird skin condition that I have. It's gonna turn red in like 4 minutes. But like I have a skin condition called dermatographia where if I don't take my allergy meds, or it's been too long since I've taken my allergy meds, my skin turns red when it's scratched or touched or whatever. You can kind of see it. It's like starting to turn red.
Yeah. And then I did want to, so that pretty much covers like mostly everything I wanted to talk about. I did have one more question from my mom that I wanted to answer first while she's still here, because she's probably going to go to bed soon.
Oh yeah.
And it is, what have you found to be the best advice for dealing with one's mental illness? In other words, what might be most helpful, in your opinion, for others to use as tools to cope with their illness? So we did kind of touch on this, I think, with this whole night. It's hard to give a cookie cutter answer because everyone's different. Like what works for one person is not always going to work for another. So it does kind of depend on that. But in general,
for me, I'd say bluntness.
I would say what's most helpful, I think, is just being open-minded and accepting help.
Yeah.
Being open to other people helping you, whether it be friends, family, doctors, your support network. Just being open to that.
Yeah, being willing to accept help.
That's what can really help you.
Elemenop.
You gotta make that bigger.
I shrank it because I wanted to move it over, but I need to make the text bigger.
Oh, yeah.
Yes.
But yeah, I would say just being open. Yeah, and like Mel says here, don't lie or hide anything. It could be embarrassing or uncomfortable to talk about something with your doctor, but they need to know these things in order to help you properly. Yes.
Sometimes it can be hard.
Being honest with yourself, with your doctors, with everyone.
You can do it.
It's very important. So I would just say being open and honest and willing to accept help.
Yeah.
Is probably the best tool you can use to help your own mental illness.
Be honest with your friends and family.
Yes, and besides that,
and your support network.
That's probably one of the most important. And then, like I said, just continuing with medication.
No one Shirty says.
Hey, Shirty. Good morning from the UK.
Yeah.
Good night from Canada. Yeah, we got the global.
Got the whole spectrum of time zones on here.
And then, would you agree with that, or was there anything else?
I would say like that, and personally, I want to throw in sometimes being blunt, like just being like, I need your help. Just directly asking, like, can you please help me? because I'm having mental health issues can be very good, especially if it's someone that you can be open with. And if you need to like say like, I'm sorry if this is a lot, but I need to talk with you very bluntly. In my experience, that helps because people can't read your mind. So sometimes just
even doctors, they can't read your mind. They can try to help you as much as they can, but they can only help you with what you give them. So if
they can only like intuit
if you've been like suicidal and you go to the doctor and say like, well, I've been sad.
Yeah, if you're like, I don't feel very good, they're not gonna pick up that you are having like suicidal ideation or anything like that.
Yeah, just be blunt. I'd say be honest and be
with your doctors for sure. With your
authentic.
Doctors and your psychiatrists, you should feel like you're in a safe enough space to be blunt.
Oh, Betsy's leaving. Bye, Betsy.
Bye.
Thanks for
Good
stopping
night.
by.
I'll see you tomorrow.
But Mom, if you're still here, I hope that answered your question. If you have any follow-up question or anything else you want us to talk about, let me know in the chat. And at this point, we've gotten through pretty much
I think we've gotten
about
through the
everything
list.
we wanted to cover with mental health treatment. So now we're going to open up just an open discussion. If anyone has questions, if anyone needs help with anything, we're here to...
We will do our best.
Like I said, we're not doctors, we're not psychologists or psychiatrists, but we'll do what we can to help.
And then next week, we should talk about eating disorders. We should put that on a list. That should be one of... I can talk about it.
Yeah, you can talk about it.
About my experience with it.
I will say at one point, I remember at school there was someone who had anorexia, and I don't think she died, but she was like in a really serious, hospitalized for it. And I remember at one point I'm like, Mom, I think I'm anorexic, because I didn't even know what it meant. This was like I was like little, and I was like, well, you're eating dinner and I thought I was bulimic actually.
Oh.
And then I was
like when you eat
they're like, well, are you throwing up? And
there?
I'm like, no. I was just like scared that I had it. It's like what's it called when like you think you're sick?
Hypochondriac. That's one that my sister has had very severely.
Yeah.
Oh, and OCD. That was another one that I've had childhood OCD.
My sister has OCD really bad.
I need a pen.
You need a pen?
How do I not have a pen here?
There's one in my drawer. Yeah.
Here.
Hey. Hello. Oh gosh.
Here it is.
Oh, you got nice music in here.
Isn't it? This is the lo-fi. This is the Stream Beats.
Oh, you're using Stream Beats now. Nice. I got her on using Stream Beats.
They're so good.
How do you feel about the fact that people who are part of the LGBTQ plus community have a higher risk for developing mental health issues?
I'm not surprised.
Here, why don't we go back since the mic is on the left side?
Also, this pen is dead.
Oh, here, I'll get you a pen.
Okay, please get me a pen.
Why don't you answer that, and I wanted to get my old phone collection.
So I'm not surprised, because if people don't accept you, or if you're like treated like there's something wrong with you, or if you have to accept the fact that there are countries where you could be killed just for existing, that's gonna have a mental toll, and it goes hand in hand. I think it's very sad, and it's sad, but it's not surprising. It's the same with like suicide rate as well. People in the LGBT community are more likely to commit suicide than people who aren't. Yeah. Oh, do you have the phones? Wait, did you find the other pen?
I have all of them. Oh, the pen.
Grab the phones, forgot the pen.
Does that ever happen where, like, you go to do something
yes. It's a symptom of ADHD. I used to have that really bad. It's better. It's slightly better now. I don't forget where I leave my phone in random rooms. I don't walk into rooms and forget what I was doing as often.
But yes, I did want to show you guys. My very first cell phone was this guy. Why do I still have all these old phones, you ask? I don't really know, but I have them all.
Have you emptied stuff off of them?
No, I don't think so.
Do they still work?
So this is a
flip phone. It looks like mine,
it's
but
so tiny.
Wait, I want to see. Do you have? Are they all? No, there's 2 flip phones.
I have 2 flip phones.
So I have.
Well, and a slide out. So this one actually had the little antenna that pops up.
Mine wasn't that old.
And I got this, I think, in 8th grade. It was a Virgin
How old
Mobile.
were you?
Like 14.
Okay, I got my first phone when I was 16.
And
it was also a flip phone, but it was one of those Verizon prepaid ones.
Pay as you go.
Because I was same. Because I had to pay for my phone myself. Like I had got a job when I was.
That
16?
belongs in a museum.
It probably is.
It's Audiovox.
Have you ever seen the museum exhibits that have stuff from like the 90s? And it's like,
oh my
I
gosh.
had that. Why is that in a museum? And it's like,
That's
that's because that was like 30 years ago.
I do want to talk about this real quick. Well, before I show you the next phone, let's get back to these comments here. As someone who's part of the LGBTQ plus and who has borderline personality disorder, I can attest that it sucks at times. Yeah, and I think the world is moving in the right direction for the LGBTQ plus community. It's obviously not where it should be, but it's definitely improving, I think. It's
like, what was the country that just legalized same-sex marriage? But there's another, it's like another, it just became like, same-sex marriage just became legal in another country where it was illegal. And it's like,
we're
getting better.
Obviously there's a lot of like cultural and religious influence to that as well, especially in places like the Middle East. Where it's like illegal to be gay.
Sin.
Like there's
at
least we live in a country.
Russia too. It's
it might be in Russia too.
I'm pretty sure it's still illegal.
But okay, let's see here. I struggle a bit with minimizing my issues even when talking to professionals. I've even had a therapist suggest that we could end the sessions when I was going through actually a really tough time. Not sure how to get better at being blunt.
It can being blunt can be hard.
Nope. 1, 2, 3.
Oh,
yeah, it's tough.
I see.
Yeah, I don't know why a therapist would suggest to just end the sessions when you're going through a tough time.
Probably because I completely get that because it was probably a thing where it was like they probably weren't a great therapist. They probably weren't the best at like seeing what you needed.
Yeah.
And so they were like, oh, this person's fine, and wanted to move on. Which is partially bad on their part for not being able to like use their intuition as a psychiatrist, therapist, whatever. But also probably an issue with bluntness because being blunt is hard. It can be really difficult.
Yeah.
Yeah. To practice being blunt. I believe in you.
And then, how do you manage your ADHD? I've tried 3 medications and none of them have worked so far. I've been successfully self-medicating with caffeine, but I was wondering if you have any tips? Steve, if you're still here in the chat, maybe you could elaborate on this more.
I can tell you one of the things that I do, which many people have pointed out to me is probably unhealthy because ink gets absorbed through my skin. I don't care. I actually write my to-do list on my wrist right here. Like I'll just write down everything that I need to do. And that usually keeps me organized enough because it's like, it usually ends up being only like really important things. So I'll usually only have like 5 or 6, whatever. And it's usually the things that are floated to the top of my to-do list. Yes, I write on myself because you can't lose this. It's like I can lose a piece of paper. It's like there's a potential I could lose this, but I'm not going to lose this. And like whenever I go to take a shower, I'd take a picture of it so it'd be on my phone. So I'd like have a bunch of pictures on my old flip phone like this of just my hand and all the writing that was on it. But that was one of the things that got me through high school, was just writing on my hand constantly. And so many people were like, the ink is probably getting absorbed through your skin. Are you sure that's good for you? I don't care.
If I tried writing on my wrist, it would turn into a giant black blob. Yeah, me too, probably.
You gotta find the right pen.
Just writing on paper. Like,
you gotta find the right pen.
Or on
Post-its is another one that some people do. You just have to find an organization system.
This is my next phone. Just show this out. Also a Virgin Mobile. This is the Oyster, I believe it was called.
Not the Clam.
Not the Clam, but the Oyster. It's still a flip phone. And there's a little screen. I think this one was in color. This other one was not in color. This was all black and white. This one had color at least, which was a huge advancement.
Yeah, my first phone was definitely in color.
Like, you can see all the little buttons. So this was like circa like 2006.
I love that you still have them.
Yeah. So
I still have mine too.
And then after that, I got the LG Rumor.
Ooh.
This one had the slide-out keyboard.
I remember those.
Yep, you remember these
Still
guys?
technically a flip phone, but...
I think I had 2 of these. I only have 1 of them now, but this is the one with a little slide-out keyboard that you can...
In my lifetime, I've had 5 phones.
Yeah.
2 of them were flip phones.
I used to like do this
2
in
of them
class.
were iPhones,
like,
and now I have the Note
slide it
9.
back.
The camera on this is incredible. It's incredible.
Yeah.
I love it so much. I also like that it has a stylus so I can draw on it.
And then after, I had an LG Envy. Well, speaking of LG, my next phone was the LG Optimus. And guys, this was a touch screen. That was some big shit back then.
The technology.
The
living in the
screen.
future.
And there's like 4 buttons, and it was slow as hell, but it worked.
Do you have like...
This was one of those...
Did you
free
save
ones
your
that got
pictures?
with an
Your like high school phone
Oh,
pictures?
gosh. Maybe.
I
probably.
saved... I have pictures from like... Looking back on them, you could count. You could count the pixels.
I mean,
they're so tiny.
Like a slide out.
Like, taking
I did like
pictures
the
on
slide out,
these,
though, but
they're tiny compared to like modern pictures where it's like 3 megabytes for one picture.
This is 3.2 megapixels.
No, not megapixels. I mean like megs.
No, I know.
Okay.
I'm saying this was a 3.2 megapixel camera.
Jeez.
Oh, this is all. Oh, I guess the LG had a camera. Probably worse than this one. But this was the touchscreen, and then after that,
Starlight says that legit was my first phone. Hell yeah!
Oh, was it this one? Nice. Yeah, it worked well.
I love the sliding keyboard.
And then, so I had that. Let's see.
Charity says my first one was a Nokia. The indestructible ones. Oh, I actually did. You know what? I had 6 phones because I briefly had one of those blocky Nokia ones.
My dad had a Nokia for literally like 10 years, and he finally had to. Hey, Gonza with the host. Thanks for the host, Gonza. My dad had a phone literally for like 10 years, and we just now got him to a new one because his old one like stopped working finally. And then after that, I got an LG. No, Samsung Galaxy S5. So this was my first like real phone. Well, a second touch
smartphone?
These are both smartphones technically, but this was like actually like a good one. And I had this I think 2014 was when I got it.
Okay.
This other one I got like probably like 2011 maybe. And then I had that for a while.
You know what I miss?
And now I have the Galaxy S8. No, S9? S9.
What is this layout called? T something? Oh, hey! Nicholas?
Hey, Nicholas.
OCOC?
Oak?
Nicholas. Anyway,
thanks for the host.
T something.
Yeah.
Hey! Hello! Thank you, Learn Only Phineas.
When I hear you say LG, I keep expecting to hear it followed by BT. Oh.
LGBT.
Yeah, when you used to have to like text and you would like click the multiple buttons.
Yes, I love that though because I used to be able to text people without looking at my phone. I could legit send text messages, like I just knew all of the operations and could text without looking at my phone. And I miss that. Because now, like, you have to look at it.
Well, unless...
But, like, people used to be able to just text under the table.
Oh, that's true.
You
can't really do that anymore.
You can't. Oh, hi, my boy. Oh, hello. Look at his big eyes.
Android for the win for an avid Apple hater. Yeah, I've never really...
I
had an iPod Touch.
I like both.
Which I lost at a movie theater. But I've never really been an iPhone. My wife's family, they're all like an iPhone family. But
I love AirDrop. Like people who have not experienced AirDrop have no idea what they're missing.
An Android.
I love having like Mac laptop, Mac like an iMac, an iPad, like just a Mac computer, an iPad, and a phone, because I can take all of the pictures from my phone and just airdrop them to whatever, or like any video that I've taken that I need for a video, I can just airdrop it to my computer where I'm editing, or if I'm throwing, like if I'm doing a drawing for a video, I can just airdrop it from my iPad to my computer, and I love that so much. But then Apple was like, we're gonna charge like $1,000 for our next generation of phone, and I was like, you're stupid, haha, please don't. No. So I switched to this, because the camera is incredible and because it has a stylus. And this one's the Note 9 because the Note 7, right, was the one that was exploding, or was it the Note 8?
I don't remember.
Which one was the pocket grenade? I don't remember. It was like illegal on airplanes, and that they shut them down.
In class one day, someone airdropped everyone for 5 minutes nonstop. Ooh, turn it off then. You can turn it off, I think. Note 7, okay. Also
Note
had
7,
an iPod Touch and I hated it. Love my Androids. Yeah, I mean, I don't mind iPhone.
There's pros and cons.
I don't know. I've never been like an Apple guy, you know.
Yeah,
I've been
PC,
both. Android.
I feel like the thing that turned me into a Mac person, because I used to be very anti-Mac until I got a Mac and actually learned how to use the operating system.
Oh, I forgot to say bye to Alex.
Bye.
Thanks for being here, Alex. Yeah, look for your next week. It's been interesting. Hey, thanks for stopping by.
Yeah, a big reason.
We'll be on my channel next week.
Yes, Baileycream.
Before you go, let me just link it in
the reason I had ended up really liking Mac was because I had to learn the operating system for my program. So I'm a graphic designer by bachelor's degree, but when I was looking into job applications and stuff, like my junior or senior year, whatever, all of them said you must be Mac proficient. And I was like, crap, I'm like one of 3 students in my class who doesn't have Apple anything. Mm-hmm. So I was like, I guess I have to get one now. And it was Phoenix. It was this one right here. And I've had it for...
You name your computers?
Yes. This one's Phoenix. That one's Raw. And then like the God... like the...
Oh, like
Raw,
the sun god
of
Raw?
Sun. Yes. And then my iPad is named Hippogriff. They're all named after mythical birds.
Nice. I just called mine Green Machine.
I like it.
I
like it. It is a green machine.
I would show you, but I'd have to turn the whole computer around.
Yeah.
So next week maybe.
Next week. But yes, so I ended up like the thing is going through a graphic design program makes you it teaches you how to have an appreciation for good design. And it's like they're not powerful, but they're really well designed machines. And if you know how to use them, they're so fluid. They work so well. It's like, I guess the way that I describe it is like having a butler almost, where it's like you could have someone do things for you and just present them to you, but you could also be the kind of person who's like, I just want to do this myself, just to let me do this. And it's like, that's more PC, where it's like you have more control over certain things, but there's like, it's more work.
Yeah.
And the other thing is like, there's just completely different appreciations for it. Like there's little like I could go off on Mac forever.
Yeah, that can be another.
Because there's so many people who hate Mac, but I'm like, unless you've owned one, you don't know what you're missing.
Yeah, it is nice. I will say they are nicely designed.
I like that all the
But
keyboards
I
are
think
the same.
They're too expensive.
This is where it is. You pay for the design, not the functionality. Versus with yours, you have a giant box full of really great parts that work really well, but it's a giant box.
But you can get, you've heard of like a Hackintosh, right?
Yeah.
So you could do that, or you could.
Yeah, but you're still not getting the design of it. This is a tower and a screen.
True.
All built into one.
They have those
in a uniform
PCs,
way,
though.
And it's like
but they probably don't look as good.
But it took them like Mac was doing this way before, and they're doing it now because Mac did it.
It's true.
Mac knows design. Apple knows design.
All right, 34. Thanks
Sorry,
for stopping by.
Yeah. They're both great.
Gonza,
pros and cons.
I don't speak much Spanish. Decir bien mi nombre cholo. Good, my name, something. Maybe I said your name right.
Okay.
So we're trying to keep the chat in English, if you don't mind. And I've had my iPad Pro for about a year, and only now have named it Blood Orange.
Ooh,
nice.
That's a good name. That's a good name for an iPad.
But sticking with the Galaxy S series, I've had S3, S5, S7, and now the S10, but I don't know what I can get next because I want a headphone jack. Yeah, I do like having a headphone jack.
Yeah, same thing. That's why I got this headphone jack.
Yeah.
My last Apple phone also was the last one that had a headphone jack, which I believe was 6. So I had the 6S.
Love the way Mac operates, but I prefer PC Android because I'm the kind of person that prefers more control, and I very much dislike Apple's ethics as a company. No hate for people that prefer Apple though. Yeah, I like.
Yeah, it's a
for
very.
Me, I like being able to customize things.
It's a very engineer friendly thing. This is
Yeah,
a very
PCs.
designer friendly thing.
That's true. Although when it comes to laptops, like I feel like I would probably choose like a Mac laptop over like a Mac all-in-one. Because like if I was going to do an all-in-one like this, I would just build a PC.
Yeah.
But it's like a laptop.
Because it's like, this is not.
Maybe I could
This
do
is nowhere
a
near.
Mac
This is
laptop,
one of the best ones. I got this for work purposes. It's not going to be as powerful as that. Like, I just know automatically, just off the bat, that one probably has like better like internal memory and RAM and like all of the things.
Okay, start
internally
I'm a
are probably
so
better
that
than
tracks. This. Yeah. What drawing tablet do you use?
Personally, I use an iPad.
I don't have one.
Yeah, I use an iPad because
after,
honestly, like, okay, so this is a thing that, like, this is the one thing where I'm like, Steve Jobs was wrong as a designer. Because a lot of the...
Was wrong?
Oh, yeah, he...
How dare you?
So, Apple was very... They had a lot of very, like, Bauhaus design ethics, which I really appreciate. It's like Swiss design, Swiss minimalism, and he was very good at that. But one of the things that he stood by was that he would never design a stylus, that he would never make a stylus, and they should never have a stylus. And it wasn't until he died that they were able to make a stylus, and that's the Apple Pencil. And it completely burned down Wacom's monopoly, which I loved, because Wacom used to be like the tablet company. They were like the tablet company. If you wanted
it, used in a lot of applications.
Yeah, like professionally, they're like I don't think iPads are like used. iPads are used by like every like professional artist individually, but studios still are using like Cintiqs and all these things. And it's like, if you want to buy a Cintiq, that's like $2,000.
Also,
it's an expensive thing.
iPads are being used a lot in the construction industry too, because like when you're on a job site, just having that,
like it's the same in like our graphic design.
Than, like, a laptop, or like, you're not gonna have a desktop out on the job.
People are switching to digital portfolios, so instead of bringing in all of their like the box full of their art and
good
stuff,
night, Mom.
Good night.
Thanks for stopping by.
Instead of bringing their big box of art printouts wrapped in like glassine paper and stuff, you just bring an iPad and you're like, here's all my work. You can look through it. Half of it's digital anyway. Why would I print it? And that's just a very modern thing. But yeah, at this point I use Apple Pencil and iPad for like all of my digital artwork because it's so fluid.
But one thing
anyway
that I do differently, that I can't understand what you do, is using a trackpad to play everything with. Including
Minecraft with a trackpad like a weirdo.
Oh.
I'm left-handed and I got used to it,
I guess. Or like
I like being able to like...
I guess you're not really into like competitive shooters.
No.
So I feel like
I don't like first-person shooters.
Using this in like Call of Duty,
I don't know if that would work. I've never even played Call of Duty. See, like, the thing is, I like being able to do this because I like using both of my hands for like using the trackpad and the keyboard. So having it right in the center is so accessible instead of having one hand on each thing.
Yeah.
It's so accessible for a left-handed person.
See, I'm just like... So, I mean, they do have left-handed mice.
Yeah, but I'd have to relearn it because I've already learned how to use a mouse with my right hand, and it's like, that's okay.
See, that's how I have a coworker he's left-handed, but he mouse with his right hand.
See, after I started using like laptops with trackpads, I realized how nice it is to just be able to use your hands for like everything. Like both, you know, moving the mouse and all the keyboard typity bits. So I got very addicted to trackpads, and then I found out that you could choose when you ordered your iMac whether you got a mouse or a trackpad, and their trackpad is better. This is another thing I don't like about Apple. I had a professor once point out to me that he hates the Apple mice because they look like period pads. And ever since he said that, I can't unsee it. Like,
gosh, you just
have you seen it? I'm sure I just ruined it for
people.
Someone. It's okay. I hate them. I hate... Wait, where is it?
What are you looking for?
I want to... Have you seen them? I just want to pull it up.
Apple mouse?
Yeah.
I've seen one before.
These?
Wait, which one?
This. It looks
Oh,
like
this one.
it
See, I'm
looks.
thinking of the
See, it
old
looks
one
like
with
a
the
little panty
with the
liner.
little
It's not
button.
even like a period pad. It looks like a panty liner.
The magic mouse. Can we show it on the thing?
I think so. Here, let me see.
One.
Is it browser window? Chrome. Pick crew.
No. We need to set this up. You should just do a display capture.
Okay.
But that might be.
We'll do it
weird.
real quick.
Well, then it's gonna show everything. Ah, wrong one. There we go.
Wrong one.
Sorry. And then let's get the chat back up. Okay. Sorry about that. Oh my god, they do. Now everyone see it. Sorry, welcome in, Cosmic Kiwi Cat. I don't think.
It looks like a little panty liner.
Yeah, ruined. Echo, you killed her.
I killed the mouse.
The mouse.
They should fix it. It looks so stupid. They haven't They updated everything, I swear, except for that.
Echo, your stream's so cool with how you set it up.
Thank you.
Yeah,
I tried. It took me like a year to get to a design that I was actually comfortable with, and like an aesthetic that I was comfortable with. And this like cute, sketchy window is. I feel like it's appropriate. But do you want to see something I'm unhappy about? Okay, watch the hearts. Sorry, I'm gonna point over here, up here. Wait for it. Wait for it. And I've fixed this. I just have to fix the GIF image link. There.
Oh,
did you see it?
There's like a split.
There's like one frame where the top of the hearts get cut off right along the top, and I didn't notice it when I first made it.
If you didn't say that, nobody would know.
I'm gonna fix it
because I haven't noticed it at all.
I've already fixed it. I just have to relink the image. I have to download it and relink it, and it's gonna be gone. But now you know.
See, if you didn't say
you get to see Silver Snowy Fox. Oh, nice you get in on the secret. My stupid broken hearts.
But I was gonna. Blue Eye asked, did either of you play Cuphead? No.
No, but I did watch a couple playthroughs. And
what is that?
Did you not see Cuphead?
No.
It's so cool. So it's a game that is actually hand drawn. So go ahead and click here, and then I'm gonna do Cuphead. And they had to go through like a whole. I think they did a Kickstarter for it. Yeah, have you?
Oh, I have seen this before.
But it's all like rubber hose style, and it's really really cool. But like it looks like an old like rubber hose animated like cartoon.
Oh, it's like a game?
Yeah, and it's got like retro oldie music, and like all of the animations and everything are hand drawn.
Cool.
But it's gorgeous. They did such a great job with it.
Plus your 3 little dots are the pan flag colors in order too.
Mm-hmm.
Oh, these dots?
Yes,
oh.
They're also CMY. Because I was like, so if this window is kind of a blend between Mac and PC. So if you look, it's the 3 dots that are here, but it's on the
the right side.
It's on the right side.
Mac's on the left.
Mm-hmm. And the colors are CMY. Primary colors: cyan, magenta, and yellow.
Nice.
And also the pan flag.
But yeah, hearts are cool.
Mm-hmm.
My friend just told me you had a Twitch, and I had to follow you here too. You
yeah.
are one of the most wholesome people on the internet.
I try to be. Yeah. So, I mean, I think if anyone has. Oh, hello, MB Asher. Welcome. Thank you for following. Was there anything else that we should? Any questions or anything before we take off?
Yeah, I mean, we covered everything we wanted to cover, but if there's anyone else that has questions or comment, oh shit, punched the calendar.
Oh dear. I need
questions or comments or.
Speaking of which, I need to get a calendar.
Anything, let us know.
The way that you guys use your calendar.
Okay. Oh, I was just saying yes to Echo is an adorable little red and black ace bean.
Thank you. I try.
Yeah, we'll be back probably next week, next Wednesday.
You stream every Wednesday at 9. I think it's roughly 7 here, depending on what time. It depends on
which time zone you're talking at. We're at 10:22 p.m. where we live.
We're in Arizona. We have our own time zone because we don't follow daylight savings. So half the time we're the same as LA, and half the time we're the same as like Colorado.
Yeah. This is fun. Thanks for talking about that. Yeah, of course. And
Yeah.
also, if you guys have any suggestions for
Yeah.
what topic you want us to talk
If there's
about
anything-
next week,
Yeah.
let us know.
Because
Either
right now-
here, or you can, if you follow Echo on Twitter or me
Yeah.
on Twitter,
And we're
you
gonna
can let us
be
know on there.
on his I want to
We'll
call
be-
it a channel.
It is a
that
channel.
what it? We'll
Yeah,
be on
we'll be
his
on my
channel
channel
next week.
Let me just link it one more time.
Yeah. And then next week,
so
some of
you
the things
guys
I want
have
to talk
it.
about is OCD and eating disorders. Because I've had an eating disorder before and I want to tell that story. And then also, OCD is the thing that that's the thing that we've talked about briefly, where it's like a lot of people don't understand it. And it's something that I suffered with in childhood, and people don't realize how like debilitating it is. But yeah, that's another one of those mental issues.
Starlight, thanks for stopping by, being a part.
Yeah, thank you for hanging out.
You have a great rest of
Great
your
evening.
night, or morning, wherever you
Yeah,
are.
if you're in the UK, good morning.
Maybe a gender identity or sexuality topic.
That would be kind of
we
interesting.
could do one on like.
We should also.
I mean, you'd be a good resource for
Yeah.
that, and then for just like LGBTQ,
Yeah.
IA2+. So many now.
It's funny how much the acronym changes. Anyway, we should also talk about
So maybe about autism and ADHD.
yes,
and bipolar?
I was gonna say
we kind
suicide.
of like gatekeeping.
Gatekeeping is a good one to. I'm gonna throw that on the list.
Okay.
Because that's another thing that could even happen within like the
What
mental health
were you
community.
gonna say though?
Suicidal thoughts. It's like this is a thing that I feel like someone kind of brought up, but like men are more likely to succeed in suicidal attempts, and part of that is because they're less likely to express emotion, or they feel more. Well, for one thing, they try more violently, so they're more successful. They try more violent methods, whereas women tend to try less violent methods for suicide, which tend to be less successful. But also, men are more likely to succeed because of, men are more likely to attempt because of, they're less likely to seek help or like express their emotions. And part of that goes back to like how men aren't allowed to express anything that could potentially make them seem feminine, because feminine is bad, blah blah blah. But it's like men aren't allowed to like express emotion.
Yeah.
And that's like
And
a
there's kinda
whole
like
cultural thing.
There's kind of like a stigma around that too, of how like.
Yeah. What was I
you know,
writing
like,
down? What did she just put?
Here.
Gatekeeping.
Like how women are like emotional and men are like not, but it's like.
Yeah. I feel like the real truth of it is like the expression of emotion, whereas this is a cool thing that I learned. So like the reason the whole idea of the friend zone exists is because women friendships tend to have an emotional element that male friendships don't have. So when men and women are friendships and there's an emotional element, women will just perceive it as friendship because that's how friendship is, but men will perceive the emotional element as romantic interest. So that's a lot of the time why men think that they're being friend zoned, or they'll become interested in their friends, or they'll think that men and women can't be friends, and women are like, yeah, we're just friends. Of course, that's how friendship is. And it's like that's just the emotional element of friendship. And yeah, that's another thing where it's like men haven't been conditioned to express like their emotions with each other.
Yeah.
Which sucks.
Especially with like men with other men.
Mm-hmm.
Very.
Yeah. Be emotional with your homies.
Yeah.
Buy your boys some flowers. Tell them you love them. Friends.
Yeah, bros.
No, love your bros. And then.
Does suck a million.
Yeah.
I do enjoy flowers. Yeah.
Oh, that's the thing. Joe Cat was talking about that. I feel like just buy some flowers. Buy a man your flowers. Buy a dude some flowers. Whoever you are. If you buy a dude some flowers, they will never see it coming and they'll appreciate it a lot. Wouldn't you love to get some flowers just out of nowhere?
I wouldn't
Wouldn't that be
mind.
nice?
It's like a thing that
Like,
like men don't
oh,
get.
that's so nice. Yeah, it's a thing that men don't get because it's so tied
Crushing
to
on friends.
women. Hell yeah, just
Want a
yeah.
Kirby
Crushing on
plushie?
friends is not
Man,
great.
I actually
But like
like
buying
plushies.
flowers. Plushies are great.
It's like when you're a kid, you know, like you had like stuffed animals, but it's like adult version, kind of.
Yes,
In
exactly.
a way.
I love that. Suicide and not gender.
No, it was gender identity or sexuality.
No, the one that I was writing. I guess I could say gender.
I wouldn't mind a Kirby plushie. Isn't that called toxic masculinity?
Yes. So like toxic masculinity is like where you try to be so masculine that you don't want to express your emotions because that would be feminine and that would make you question your masculinity. Where it's like you do things that actively harm yourself in the pursuit of masculinity versus I got gatekeeping. But yeah, it's like where you do things that are harmful to yourself in the pursuit of masculinity.
She wrote that. Got it.
I got it. Thank you. But yes, toxic and like fragile masculinity is the other thing where it's like if a lady scented body wash could destroy your masculinity, where it's like, I can't use a lady body wash though, no, that would make me less of a man. It's like you have very fragile masculinity.
Yeah,
then it is not the end of it's good smelling soap.
So like lady
Calm down.
like shampoos and conditioners.
We have so many more scents.
I'm so about
all
that.
of yours are like musk.
Yeah.
It's like sandalwood. It's like you have so few options because fragile masculinity is so prevalent that men won't buy things if it's like
too girly
smell. Whereas like Allspice, I love Allspice. They've started selling like more like slightly fruity, slightly feminine things, and I like this because it's partially marketing to men who are less fragile, but also to women who use men's deodorant, which is the thing that like a friend of mine turned me on to because she was like, it works so much better. And I was like, it totally does. And so like
it's like because men sweat more.
Yeah, men sweat more, so it's like it's stronger. And I'm like, yeah, I sweat a solid amount. I'm like a heavy set girl. Why not? So like now every now and then I buy like Allspice body whatever it is, deodorant, because they actually have smells that are like gender neutral, where it's like kind of sweet but kind of like earthy. I don't know how to describe it. They've got a good range of smells right now. So if you're a gender neutral person in general, or you don't care, Allspice has some really good smells. In general, I like that.
Sandalwood?
Yeah, it's a smell.
Men are called gay for being feminine, but maybe they're just very secure in their masculinity and don't care.
I love that.
I mean,
I love it when a man is super secure in his masculinity, where he's like, I appreciate this feminine thing. Because it's like, some of the things that are coded as feminine have like no actual root in gender, like high heels and makeup. There's no reason that those are specifically feminine things other than we have decided that they are feminine. Where it's like eyeliner.
The only thing I think about high heels is just like to make up like the height difference in general.
Actually, they were invented for men. Like for soldiers walking through puddles when they needed to like walk through, like when they needed to walk through things and stay out of them. It's like high heels were invented for men. Eyeliner was originally like from Egypt, the darkness around the eyes, because it protects your eyes from the sun. So it's like almost like sunglasses kind of. It's like that's what I've heard anyway. These are things like, but yeah, same thing with skirts too. Skirts were originally designed for men. There's
kilts.
Yes. See, it's like these are things that we've just decided are feminine.
No, like and like how like women can't wear pants, but like guys can. But like anatomically, like skirts and kilts make more sense for guys, and pants make more sense for women.
They really do, don't they?
Because guys got stuff down there.
Yeah, that needs to breathe. That was straight up a thing. Like I had a boyfriend at a point who was like, I just want to wear skirts that everything can breathe. And I was
Yeah,
like,
I want to get like
that makes painfully makes a lot of
I
sense.
want to get a kilt.
Did you ever see
And
that
in
one?
the true Scottish ways, you wear a kilt and nothing under it.
Did you see that one? There's like a clip from The Good Place where she's like, he like says like, do you want to know something that doesn't make sense? And she was like, is it how we have lots of pants with two legs, but we don't have like one piece of pant or like one pant leg that's just like one big leg? And she was like, you mean a skirt? And she's like, no, my thing is different. And it's like, yeah, one-legged pants.
Yep.
Yeah, there's no specific reason that these things are gendered. And
men wore wigs too. True.
Yes, that's
like
true.
The old timey.
Yeah,
white
and it's
wigs.
like there's no actual reason why these things are gendered,
why
so
did
there's
they even
no
do
reason.
That? Anyone know like why
they wore powdered wigs?
Yeah.
I want to
what's
say,
the point?
like, I remember
is it to make you
hearing
look
that
old
like
and respectable.
a part of it was because like it was harder to keep your hair clean, so it was a way to have clean hair, because it was like not your hair, so you could keep it clean. I could be wrong. I don't know completely why, but that's what I heard about like women in France who would like they'd wear wigs and powder their hair because you wouldn't wash your hair.
I've heard that the high heels were invented for butchers so they wouldn't get the floor too dirty with the animal
There you
blood.
go.
Hey.
But yeah, I know that high heels were originally invented for men. I don't remember why.
Men's shirts buttons to the left and women's to the right because people assume women had handmaidens to button them versus men who would do it themselves.
Mm-hmm.
So
Works for me because I'm left-handed, so.
Oh, so it works better for you. Huh. And also, don't like women's belts go the other way too? I
think they do.
Like,
I think mine goes
to
this way.
The right. Like
mine goes this way, right. And then it like hooks into the buckle like that. Like the buckle goes
does it, like
this
when
way.
You're putting it on, you go like this?
Yeah, like I'll hook it that way. So I think it is opposite. I could be wrong. I haven't worn a belt in a long, long time. But yes, these are things that have no need to be gendered. And so it's like if like these things shouldn't.
Oh, that's why they wear the black paint under your eyes in sports.
Mm-hmm. Like these things shouldn't
sense
hurt your masculinity or make you feel like you're less of a man because you're doing something feminine when there's no specific reason for it to be feminine other than we've decided it is. And that's the thing where it's like women have an easier time doing men things than men do women things because it's okay to be a man. So like I can wear pants and have like any job and be a CEO, but men have a more difficult time doing things like being a house spouse or like wearing skirts, wearing nail polish, anything that like wearing high heels, like doing things that are traditionally ascribed to femininity because femininity is like the bad gender. Like being a woman is the bad thing. So it's harder for men to do feminine things because of that. It's like, it's stupid how it cycles back to the patriarchy. Whereas if we were just like, ooh, women things are cool, then you could do so much.
Mel says, I hate how loud heels are.
Yeah, they clack.
I feel like, well, I mean, I've never really worn high heels, partially because they don't make them in my size.
Wait, what's your shoe size?
13.
Yeah, so like with Mac, she wears size 10 in men's, which is a size 13 in women's.
So I would be size 15 in women's, which is just like no one has.
And it's like every store carries up to 12. 12 is the highest that they. So like finding shoes for her was impossible.
Yeah, but I feel
like we were always on the lookout.
I mean, even like men's dress shoes can be allowed too, but I kind of like that because it's like
it's commanding.
It announces your presence, like, "Hello, I am
here.
dressed for the occasion."
I feel like
we just to party.
Yeah, I feel like I just need to take that stance with heels and be like, "I'm here now, and you have to accept it."
Have a good night, Blue Ivy.
Good night.
Thanks for being here. Appreciate it.
Thanks for hanging out. Yeah, we gotta take off. It's like getting late. I gotta go.
We're gonna end it up here, but thanks everybody for being here. Really appreciate it. Thanks for hanging out. I'll give my
drop
last
your thing
of the night because next week
we're gonna be on his
my
channel,
Twitch TV /
talking about eating disorders and OCD and maybe more gender differences. I do a lot of I study gender studies sometimes just for fun. I'm a loser internet person like that. You have to be like, if you're going to be an internet personality, you have to be very aware of things because you can very easily accidentally say something offensive. And so to avoid that, good influencer, you gotta know what you're talking about.
Yeah.
Yeah.
But I hope we helped some people here tonight. Thanks for being here, for getting your voice heard, and
hopefully you learned something.
Hopefully you learned a little bit about mental health treatment. This has been Echo and Baileycream, or Dan, or Danny, however you know me. Signing off, I guess.
Yeah, I think we're gonna take off.
Yeah.
You guys have a good night. Don't go on for a loser.
Have a good night, everyone, and we hope to see you again next week.
Yeah,
probably the same time.
And I'll probably be streaming tomorrow also to draw some emotes.
Yes, and I'll be streaming tomorrow also at night. We're doing our WoW raid tomorrow night.
Yeah, I'll probably be streaming mid-afternoon, so before you.
Progression.
If I'm still streaming by the time you're streaming, maybe I'll raid you.
Yeah.
Okay, cool.
All right.
Take off.
Thanks, everybody.
Thank you guys for hanging out.
Have a good night.
Good night.
Appreciate
good sleep.
it. Get some good rest.
Bye.
Good sleep. And we'll see you next time.